today's inaugurator is Dr. Sridhiv Chatterjee, Assistant Professor, Department of Physical Education, Jadavpur University. Then Madhusudan Hazra ji, Dr. Madhusudan Hazra ji. He is HOD, Department of Physical Education, Prabhat Kumar College, Vidyasagar University, Kontai. Then Dr. Aparup Konar ji, Director of Physical Education, Office of DPI, Sport Board, Jadavpur University. And Mr. Palash Pramanik, he is research scholar, UGC National Fellow from Jadavpur University, the same department. So I would like to welcome them all. And for official welcome address, I would like to, before official welcome address, I would like to communicate my gratitudes to our guardians, V.K. Agnihotri ji, Jagdishwar ji, Jayesh ji, and Vishnu Prasad Sharma ji for blessing us. Now, I would like to request Professor P.P. Sharma ji, Vishnu Prasad Sharma ji, to bless us with his respected Vishnu Prasad Sharma ji.
Yes. Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri ji, Dr. Pawan Kumar Sharma ji, eminent speaker, distinguished guests, ladies and gentlemen. Today we have webinar on need for positive health, exercise and sports. It is a wonderful seminar. I welcome all the eminent speaker, distinguished guests, ladies and gentlemen for this webinar. Today we have an eminent speaker, Dr. Sridip Chatterjee, Dr. Madhusudan Hazra, Dr. Aparup Konar, Mr. Palash Pramanik. So I welcome all the eminent speakers, guests, ladies and gentlemen, to today's webinar on need for positive health, exercise, and sports. So I declare today's webinar is open and love you. Thank you. Thank you.
Now I would like to request today's inaugurator, Dr. Sridhiv Chatterjee. Sridhiv ji, welcome. He is the inspiration for today's program along with Puneet Bhattacharya ji. Thanks to all speakers. Welcome Sridhiv ji. Now stage is yours.
Good evening all. We are assembled here to celebrate a great day, that is International Day of Sport for Development and Peace. It is a great decision has been taken by the UNO, and it will be celebrated 6th April every year annually, that means. And the way they hypothesized their objective, it is like that: securing a sustainable and peaceful future for all, the contribution of sport. Yes, we are all agreed. Even in this platform, we meet together today, and all the speakers, I hope all the speakers will share their views, their experiences, and definitely they will cover all these aspects, how sports and physical activity could be a medium for the sustainable development of peaceful future. So without wasting of much time, I just convey my sincere gratitude to everybody, all the dignitaries in this platform, and all the speakers. Those the main focus today. I am also ready to listen those speakers, and I, from my personal behalf, I welcome you all, and waiting for your speech. And with this, I hand over the platform to the Pawan Kumar Sharma ji. Please go ahead. Thank you.
Thank you, Dr. Sridip. Thank you very much. Now I would like to request, this is very excellent communication by yourself. Definitely, in our life, we have the scope of sports, exercise, and yoga all to achieve the holistic life. And today we are very fortunate enough that Dr. Madhusudan Hazra ji is with us, Assistant Professor in HOD Department of Physical Education, Prabhat Kumar College, Vidyasagar University, Kontai. Welcome, Dr. Hazra. Welcome. Now, because this is a absolutely not known subject to us, so we are dealing with Ayurveda and we are recommending exercise and yoga, but we would like to listen from you, young dynasty. Thank you. Thank you. मधुसूदन हाजरा जी, आपकी आवाज नहीं आ रही है. We are not getting your voice. You can communicate directly without speakers, without microphone also.
पवन जी नमस्कार.
वेलकम सर, वेलकम सर.
हमारा आवाज ठीक है ना जी?
क्लियर है सर, बिल्कुल क्लियर है. निशांत जी नमस्कार.
निशांत जी नमस्कार.
नमस्कार. नमस्कार. हमने कहा डॉक्टर मधुसूदन जी एक बार ईयरफोन हटा के ट्राई कर लीजिए.
हाँ बिल्कुल. विष्णु प्रसाद जी नमस्कार. अग्निहोत्री जी नमस्कार.
सर नमस्कार. आपने अभी पूछा कि हमारी आवाज ठीक आ रही है.
हाँ
अरे आपकी आवाज बहुत बढ़िया, हमेशा बढ़िया बनी रहे. एक बार आवाज गड़बड़ हो गई थी तो 1 महीना हमने मिस किया था आपको. इसलिए आपका गला, आपकी आवाज एकदम सही रहनी चाहिए.
मदन जी की आवाज कोई स्टूडियो की आवाज लगती है एकदम.
डॉक्टर साहब हमारी लगता है एक पंचकर्मा करनी पड़ेगी, फिर तो पूरा 5-6 हफ्ते हमारी हॉलिडे आप लोगों से लेना पड़ेगा. फिर
वो अलग बात है, लेकिन आपकी आवाज सही, इन्होंने कहा पढ़ी नहीं कि वो ऑल इंडिया रेडियो के अनाउंसर वाली आवाज है.
मीठी आवाज एकदम.
हरिओम हरिओम.
और कैमरा ऑन हो तो और उसमें 4 चांद लग जाए.
अभी आया जी कैमरा. अभी
आज सभी लोग पीछे पड़ गए इनके. ऐसा नहीं है. जयेश जी की आवाज बहुत बढ़िया है. मैंने तो
बिल्कुल. जयेश जी इज आल्सो बहुत क्लियर.
बहुत ही बढ़िया आवाज जी, नो डाउट.
निशांत जी यहाँ पे ऑस्ट्रिया में एक है जी इंसब्रुक जगह. अब इंसब्रुक वहां पे ये स्पोर्ट्स का कॉलेज है जी, स्पोर्ट्स एजुकेशन. अब क्यों करते हैं लोग कि स्कूल की बच्चों के लिए उस तरफ ले जाने के लिए स्पोर्ट्स. अब ये कॉलेज ऑफ स्पोर्ट्स एजुकेशन, स्पोर्ट्स पेडागोजी, स्पोर्ट्स कैसे पढ़ाएं बच्चों को, तो उनके एक सर्वे चल रहा है यहाँ ऑस्ट्रिया में पूरा स्कूलों में. वहाँ 770,000 school children, secondary school बच्चे और 90,000 teachers की survey करते, sports वाले करते हैं, उसमें क्या निकल आ रहा है कि 30% of school children are obese or overweight.
Because of less physical activity.
बिल्कुल बिल्कुल, because of reduced physical activity और ये जो कंप्यूटर के सामने बैठ के काम करने वाली आदत, ये तो it is increasing.
Plus fast food.
It's a very dangerous thing. अब उनके एक और ये आ रहा है कि physical activity tracks with life. If you start बच्चों को शुरुआत से थोड़ा सिखाओ physical activity, then it stays with them for the rest of the life. इसका मतलब health can be a habit. You can teach healthy habits in children. अब पवन जी ने जो पकड़ रखा है topic is a very very important topic. जहां भी देखो this is a problem. खाना तो आसान हो गया, सुपरमार्केट जाओ खाना ले आओ, and that is a very high calorie खाना. बिना, you don't need so many calories. If you are not out active, you don't need so many calories. You have taken, it is tasty food, you eat this food. So we have many issues that are coming together that shouldn't come together. Not only Viruddhahar, but a very habit has become, some strange habits have come together. Viruddhahar to dusri cheez hai bilkul. Physical activity ke saath. So two medicines, physical activity and food becomes the two medicines that is known in Ayurveda. Vyayam is understood very clearly in, and Ahar as Aushadhi is also understood in Ayurveda. But the people who are doing this study in Europe have never heard about Ayurveda. This is a interesting situation कि हमारे पास पूरा जो कुछ है, it is in our system. They have the data, observations. इनके पास, they have done the survey, etc. I think by coming together, उनसे भी सीखें और उनको भी सिखाएं थोड़ा हमारी तरफ से, then it becomes a very nice cooperation. ये यहाँ पे यूरोपियन यूनियन में अब चल रहा हेल्थी सिटीज के ऊपर डिस्कशन कि क्या होनी चाहिए हेल्थी सिटी के अंदर, how to make it friendly for people to walk, to cycle, कि कैसे डिजाइन होनी है सिटी का डिजाइन. So these are all things. अब हिंदुस्तान में अब काफी चल रहा है डिस्कशन स्मार्ट सिटीज के ऊपर. अब इसमें अगर थोड़ा सा सोच लगाएं how to design these smart cities to be health promoting. हिंदुस्तान में एक चीज और जी, हमारी NCERT वालों की स्कूल सिलेबस एक पूरा उनके एक डॉक्यूमेंट है, I will send that document, 200-page document है, health promoting schools, and how to make it health friendly for children. And it's a very important, very, very important area that we are discussing today. And so it is so wonderful that Pavanji has identified this area and he has brought so many of us together. Every day we have such wonderful discussions. Aaj Srivats ji bhi hai hamare saath. Srivats ji, namaskar. Kerala se, Srivats ji is our...
Namaskar, sir. I am on travel actually. So I just
you're traveling. But we are happy you could join. Srivats ji hai RAV ka marma chikitsa ki guru, Kerala se. And Srivats ji is the first person, he was responsible for setting up the AYUSH Ayurveda Sports Injury Center in Thrissur. So Srivats ji, very happy you could join us today. Thank you so much. Our first presenter is having some difficulty with...
he has joined, sir.
Acha, chalo, Pavan ji, aapke, please.
I welcome Dr. Madhusudan Hazra ji. Are we audible to you, Dr. Hazra? You are unmuted, Dr. Hazra ji.
Hello.
Yes, welcome.
Am I audible?
Yes, clear.
Okay, so there is a little bit of issue related to my microphone, So right now I am connecting directly with my computer. Okay.
Welcome, welcome.
Okay. Just a minute, sir. Hello, sir. Am I audible, sir?
Bilkul, very clear. Thank you, Madhusudan ji.
Thank you. Thank you, sir.
Madhusudan ji, one request. थोड़ा सा अगर light आपकी थोड़ा सा ऊपर से या side से अगर थोड़ा सा light हो, फिर it will be very good. But it's all right. Quick. Thank you. This is
Okay, sir.
but yeah, we can continue with this. Thank you. Thank you, Madhusudan ji. Thank you for joining us today. We look forward to hearing your thoughts on this very special day.
Okay. First of all, I'd like to thank for giving me this opportunity in this very nice platform. Independence Research Ethics Society, who have invited me for the lecture in this particular evening. So very beginning of my lecture, I just like to convey my sincere gratitude and thanks to all the members, those who are over here in this platform. And especially I like to thank Dr. Sridip Chatterjee for giving me this opportunity to speak my views related to exercise and mental health in this platform. Okay, so directly already I took a bit of time due to the technical issues. Directly I will enter to my presentation. So right now I am sharing my screen. Is it visible?
It is just coming. Oh, thank you.
Okay, is it visible, sir?
Very good. Could you put it on presentation mode?
Okay, okay, wait.
Thank you. Very good. Thank you.
Okay. So as it is told me before that I'm just allotted only half an hour. Am I right, sir?
No, we have less time.
Excellent, excellent. Time is yours.
Sorry, sir?
This platform is yours.
Acha.
Okay, so within
Don't worry, only
within
3
that,
speakers are
within
there,
that-
so you
Okay,
can
3
take your
speakers.
own
Okay,
time.
please.
Everything is inspiring for us.
Very good.
Okay,
Thank you.
so within that given time, I just try to share the knowledge, whatever I have, and same time, all the comments and all the questions are always welcome from your side. So directly, I will just now enter in the topic in which I'm just trying to speak, trying to focus on some light. The area on which today I will talk is exercise with population medicine for mental health. So I am a Dr. Madhusudan Hazra, Assistant Professor and HOD, Department of Physical Education, Prabhat Kumar College, Kantai, Vidyasagar University. It is in West Bengal. Okay, so the area in which I will talk about is exercise is a population medicine. So there is a term population medicine. So just in the next slide, there is a picture. You can see over here that there is a picture of some medicines. In any kind of health related issues, we just try to take all these medicines. We just use these medicines. If we have fever, we use medicine. If we have cough and cold, we just go for the medicine. But what is that actually population medicine? As per my topic, it is population medicine for mental health. So what is population medicine is. Look into the definition, not definition, what is actually population medicine means. That population medicine can be defined as a series of activities that can be healthcare system along or in a conjunction with partner in different sectors to promote total population health beyond individual needs. So here the emphasis should we do in the line, the promote total population health. Total population health means the population of the senior citizens or population of the individuals in a mass. So population medicine is a factor which we have to give emphasis later on. Okay, so there is one kind of medicine. What is that medicine which may be used as a population medicine? Would you name that medicine is? Yes, that name of this medicine is exercise. Exercise is the population medicine, and here I will emphasize on the mental health, that how mental health can be promoted or mental health can be developed through the exercise and it will work as a population medicine. So could you name one medicine which will be directly help to get the solution of these all issues? Could you have any kind of particular medicine? If you want to slow your aging process, if you decrease the osteoporosis, if you want to reduce the cardiovascular disease, if you want to decrease the blood pressure or decrease your anxiety, or you want to boost your immune system, you want to boost your motivation, do you have any kind of medicine? Could you name? Yes, there is one medicine which will directly affect all these issues and give you or promote your health through all these issues. That is exercise. Exercise is the best medicine. If you want to take the pills of this exercise medicine, then definitely you will get the benefit out of that. So exercise will work as a medicine, as a population medicine. So later on I will explain how it works. There is different type of exercise pills. Different type of exercise pills. Here in the picture you can see that someone is doing jogging, someone is doing gym, someone is doing the skipping, someone is doing exercise with medicine ball, someone doing gymnasium, someone doing cycling. So these all are the different pills of exercise. Any problem, sir? Any different pill of exercise. If we are able to take the pills, if we are directly motivated to take all these pills in as per our requirement, then definitely we will get the benefit out of that. Whatever issues was there in my previous slide, whatever issues is there, these issues may be solved. These issues may be maintained through or maybe promote through these all kind of exercise pills. Okay, now come to the point. As per my topic, I took the topic that health exercise is a population medicine for mental health. So now I am entering in my area. What is that? Here in the picture you can see that a healthy mind lives in a healthy body. A very popular sentence is those who are engaged with the sports and engaged with the activities or engaged with the any kind of recreational game or any kind of activities, everybody knows about that. A healthy mind lives in a healthy body. So here is the connection you can see. Okay, Didi. There is a connection. You can see that mind and body, healthy mind and healthy body. What is that actually? There is a connection in between. So if we have the healthy body, then we may get the healthy mind. If we have the healthy mind, then we may lead towards a healthy body. So there is a connection in between healthy mind and healthy body. Here you can see that here you can see that the mind-body connection. What is the mind-body connection? The psychological aspects and the physiological aspects, they both have a bonding. What is the psychological aspects? The thought, attitude, and the behavior. Whatever we are behaving, whatever is our attitude, whatever we are thinking, it has a direct relation with our physical condition. So physiological aspects and physical health is directly connected with the mind, with the psychological aspects. So there is a mind-body connection. As I told you before, it lives in healthy mind. So the connection is like this. Okay. Here in this picture, you can see that a gentleman, a fellow, is sitting in a sit-up bench in a gymnasium. Okay. So in the gymnasium, he is ready he is just trying to go for the workout, and he's saying the mentality, whatever is going on in his mind, he's saying that, oh God, give me strength. I don't think that he needs enough strength for any kind of exercise, because he is already a muscular fellow. He has that strength to do any kind of exercise, to put on any kind of weight for any kind of repetition. He had that much of, as per his physique, we can guess that he has that ability. But where is the lack? Where is the lacuna? Why he is in this condition? Why is he not able to do the exercise? That is the mental health or psychological health. This fellow is physically very strong, maybe physically very strong, but the lack is there, his mental health or psychological health. He is ready to work, but his mind is not allowing him to work with the dumbbells, work with the gym equipments. So that is why he is retired from his activity. It's all about mind or brain, how it's receiving stimulus, how it's processing all the information and response against the stimulus. So it's all about brain and how it works. Okay. Now, if I look into this cognitive domain, means where the all processing information takes place. This is the Bloom's taxonomy. Here we can analyze. Here the Bloom's taxonomy. It is established in 1964. So here there is a three-part: the cognitive domain, affective domain, and psychomotor domain. As we are from the professions of physical education and sports, so most of the time we deal with the psychomotor domain. Most of the time, as per our requirement. So Bloom taxonomy, what actually it's saying? It's saying that creating, evaluating, analyzing, applying, understanding, and remembering. These all are the factors takes place one by one when any cognitive process takes place in your mind. It's basically related with the learning of any kind of traditional educational purpose and or any kind of activities which is directly engaged with your cognitive sense. So creating, evaluate, analyze, apply, understand, remember. So these all steps takes place one by one. As per our requirement, we will talk more about the psychomotor domain. What is psychomotor domain? Psychomotor domain, here we will directly focus on that picture. This picture, psychomotor domain. Okay. Psychomotor domain means psycho and motor. Here, motor is related with the physical condition, physical health, and psycho is related with the mental health. So, how it's taking place in your body to execute any kind of functions or execute any kind of skills, it's directly related with that. What is that? Whenever we go for any kind of activities, any kind of physical activities, which is directly connected with your physical movement, means motor, and mental condition, that psycho, then it will execute the origination. How? First of all, in the lower level, we have the perception level, then set, then guided principle, guided response, then mechanism, then complex overt response, adaptation, and origination. So these all steps in the mind by the help of the physical activity get together and we execute certain skill. If there is an absence of any skill or any steps, then we are unable to do the perfect one, whatever we are required for. Okay, so I already talked about the psycho and motor. Psycho, mind, and motor, which is related with the movement of our body. Here, different parts of the brain where the main things process. Whatever we are doing, the main factory, main machinery is set up over here. How? If I go for the or study the structure of the brain, there is a very different type of lobes over here. That is frontal lobe, parietal lobe, occipital lobe, cerebellum lobe, brainstem, and temporal. So many lobes is there, and as per the information we are gathering on, or whatever we are trying to do forward, is depends upon the activity generated in the brain itself. And specific lobe is already there, which capture that information and process that information for our next response. Okay, like if we have here you can see the parietal lobe. If I go for mathematical calculation, then directly this lobe will engage with that particular task. And what will be happen? Mathematical calculation will be solved as per the ability of that lobe, as per the functioning ability of the lobes, and it will be solved again. In occipital lobe, there is a vision which is interpreting to see what we are seeing. Suppose we see something different, which is not acceptable by my own eyes, then it will interpret what is actually that, what I saw. So this is the work or function going on that particular lobe. So somehow these all lobes have different kind of function, and this function is going on throughout our life in a rapid process. Now come in this picture, how we are feeling. Most of us, today we all are habituated with all these emojis. Any kind of message we got in WhatsApp or any kind of message we got in messengers, directly we use the emojis without explaining the words, without writing any kind of sentence. We just put emojis over there. We just send the emojis. So emojis actually what is described. If we have the happy expression, the emoji is something different. If I have the anger expression, the emojis are something different. So it depends. It depends upon the situation. Whatever situation we are facing, or whatever situation is processing in our mind, as per this mind situation, as per the acquiring situation, we are actually we are expressing, we are behaving. So happy, embarrassed, scared, nervous, goofy, surprised, these all are the kind of emotions which we are having in day-to-day, everyday lives. I told you before, I told you about the emojis, that how you express yourself. But that expression is facial expression. There is something relation in between. The facial expression is coming out from any sense, any kind of different kind of sense, which is generating in our mind, So this sense directly related with our physiological condition. How? Suppose we are having anger, we are getting anger, then it's directly related with our liver. If we worry about something, then it will affect our stomach. If we fear, then our adrenal and kidneys may be affected. It will directly attached with that emotions. If we are getting soft, then our kidneys will directly engage with that particular event. Stress or weakness, anxiety affected digestion problem, digestion system. Our body have the digestion system. So if I have the maximum amount of anxiety level, then our digestion process, digestive tract or digestive process will be disturbed. So sadness affect our lungs. So these all are the body and mind connection. Our emotions is something different. Anxiety, in anxiety we are showing bit of different kind of facial movement we have. But what actually happening in our body, some organs are engaging with that particular emotions. Anxiety affect the digestion like that. Now, psychological benefit of exercise. As I told you before, that we need to take the pills of exercise. If we have the anger and it's directly affect our digestive system, then what kind of pill we have to take and what actually it do? The psychological benefit of exercise. Psychological benefit means if we do exercise, then all these emotions may be controlled or maybe managed or maybe maintained. Okay. So what actually this pill do? as far as the psychological benefit is concerned, it's directly related with our improvement of moods, reduce stress level, as well as improve ability to cope up with stress, improve self-esteem, pride in physical accomplishment, improve body image, increase feeling of energy, decrease symptoms associated with depression. So if we have the depression in a certain level, then if we engage with the physical activity, it may be maintained or it may be reduced by the help of that exercise field. Now come to the point, how this all facial expression, all this emotion may be managed. As I told you before, when I show you that the image of this brain, the different lobe of brain, that time I told you that function is taking place. So many kind of function is taking place in different lobes. So there is a view. Here you can see that exercise and brain. Here in this picture you can see that after 20 minutes of sitting quietly, the function or the what is called the movement of the neurons inside of our brain, or the activity or the electrical flow in our brain is different. And after 20 minutes of walking, it's something different. So what is actually required for us? The movement, the energy is more required for the task. So definitely we will choose about the walking, because after exercise, our brain functioning more rapidly, and whatever function, whatever task is coming on, it's able to accept all these tasks very frequently. Whenever we talk about the brain functioning, that time we must talk about the neurotransmitter and neuroplasticity. Neurotransmitter, what is that neurotransmitter? There is a chemical which is triggered, or the hormones which is triggered the function of the brain. Okay, it's fit into the receptor like a lock and key. So if you do regular exercise with a certain guideline by to directing to achieve certain kind of physical fitness components, like if you want to your endurance, so that time this neurotransmitter receptor will help you to manage the information, whatever you want to achieve. Then neuroplasticity, the brain changes due to its certain environments. As per the requirement of the situation, brain become better flexible. Whatever information you already stored in your mind, if you are unable to accustom with that situation on that particular time, then what will be happen? If you have the neuroplasticity functioning properly, then this neuroplasticity automatically engaged with that environment, and it will adapt all the situation, and in a positive direction it will give you the proper behavior. So neuroplasticity is something which will manage your brain functioning. So in younger brain are more plastic, but older brain still experience changes throughout our life. Younger brain is more plastic because the energy, whatever we have in a younger age, it's something different. The hormonal changes or the behavior in our body in younger age, something different. So the neuroplasticity is directly affected by that functions, and it will work more better. Now come to the cognitive function. How exercise improves that cognitive function? Exercise improves memory by increasing molecular targets like the brain-derived neurotrophic factor, BDNF. This molecular factor increase synaptogenesis, means the deviation of the synapse and the forming new synapse that mediate learning and memory, making it easier to absorb information for a long-term memories. So you can see over here that by the help of exercise, by the peel of exercise, what changes is coming in our brain functioning level? The BDNF change. The brain-derived neurotrophic factor is changed. The molecular structure is changed. So that is why whatever we are getting the information, it's coming very quickly, very rapidly, very clearly, and it's stored in our brain for a long-term memory, as a long-term memory, not for a, as a long-term memory. Exercise and cognitive function develop, protein develop. So that is why the not sorry like that BDNF is not developing. The protein components of this BDNF is developing. Protein develop as a result of chronic aerobic exercise. Aerobic exercise, when we engage with certain kind of aerobic exercise, means with a sufficient amount of oxygen where it's engaged with, that time the protein components is developed. So that is why if the protein components is developed, our functioning ability will be more. Our functioning functioning ability will be also developed. Stimulus neurogenesis. Neurogenesis means here also the neurons, neurogenesis, neuro and genesis means deviation. The production of more neurons is take place. Here, if suppose the production of neurons is more, then what will be happen? Whatever pattern is there in our brain, whatever pattern going on, or whatever structure is in our brain, it's changed. Suppose here you can see in mobile we are using pattern. Suppose one point to another point, then another point, then another point, then unlock our mobile. Same type of pattern is there in our brain, which actually what it do, it's sending the information. It's sending the information from one point to another for analyze, then from that point to another point for evaluation, from that point to somewhere for something more steps. So like this, there is a pattern. So if the pattern is short, the electrical flow is short, the message carrying ability is short. If the neurogenesis is there, means neuron deviation is there, means the more neurons is generate over there, what will be happen? The pattern will be more complex, not more complex, it will be more structured. So that time the miracle grow of a brain will take place. And hippocampus, responsible for learning and memory, it's also developed. It's regulating learning, memory, encoding, memory consolidation, and spatial navigation. Spatial navigation is related to the any kind of areas or place, whatever we have already experienced. So in this kind of situation, we stored in our mind. And memory coding, what is that? What is that? Suppose memory coding. If I give an example, memory coding, what is that? Suppose we are facing certain kind of situation right now. So if I want to remember this situation for a longer time, what we need to do is we have to code this situation with something different. If I relate this different thing with that particular situation, what will be happen? It's stored in our mind for a longer time. So there is more thing. BDNF is literally fertilizer for the brain, foster growth and development, promotes stem cells to grow into the nerve cells, increase plasticity and all that. Okay. Exercise trigger up neurotransmitter. As I told you before, that the neurogenesis take place. So the neurotransmitters also engage with certain kind of exercise, which will be more effective. Exercise balance neurotransmitter along with the rest of the neurochemicals in the brain. Whatever neurochemicals is there for sort of activities, all the neurochemicals also maintained by the neurotransmitter. What is all that neurotransmitter? Serotonin. Serotonin is one kind of neurotransmitter. It works in the brain like a policeman. Keep the brain under control. Influence mood, impulsivity, anger, aggressiveness, calmness. We all little bit of know about all these things. Norepinephrine. What is that? Amplifies signals that influence attention, perception, motivation, and arousal. Dopamine, which will affect this neurotransmitter affect the learning process, the reward, attention, and the movement and the addiction. So these all are the functions. Perception, this is function. Motivation, the way we are getting motivated So this is kind of function. Arousal level, this is also kind of function which is going on in our mind. This all functions is going on or generated through the help of this transmitter, neurotransmitter. This all neurotransmitters is energized. Its study shows, the research shows that this all neurotransmitter energized by the help of exercise, by the help of pill of exercise. The mental benefit of aerobic exercise have the neurochemical basis. So aerobic exercise, if you do regular aerobic exercise, aerobic kind of exercise, that time the neurochemical will also increase. Your stress hormone level, there is two hormones which is directly related with the stress condition of yours. This stress hormone will reduce if you do regular exercise. It also stimulates the production of endorphin chemical in the brain that are the body's natural painkiller and mood elevator. So if you want to swing your mood, you just engage with the exercise. You can find the condition. You can feel the euphoria that you can feel the pleasure that something is going on, something good is going on in your body. So endorphin is the chemicals which will directly affect your body. It will work as a natural painkiller. Suppose the sports person, those who are going for the exercise or those who are going for the suppose running for a long time. So suddenly after starting the jogging, he will face certain situation. That particular situation, what will be happen within 2, 3 or 5 minutes, he will get bit of pain in his joint, in his muscles. But after continuing for a longer time or certain time, what will be happen? Something miracle will be happen within his mind, within his body. This all pain will slowly remove out. So there is certain kind of neurotransmitter which will directly, or the chemicals which will directly help him to reduce all this. Okay. So I already talk about the pills. I already talk about the exercise pills. If I talk about the drugs which have the side effect, then what these all drugs which will directly affect your body, your mind. That is some drug example I have given over here, Prozac, which is directly related to the depression and panic disorders. If you have the panic disorders and if you visit any doctor, he will directly prescribe that one, Prozac. Then if you have anxiety or panic disorder, Xanax, Lexapro for depression and anxiety, Zolofit for depression or ADHD for drug for Ritalin drug for ADHD. So these all are already manufactured by different companies for your health, for your mental health, for your physical health. Okay. But there is certain pills which I already told about, that is exercise. It's also help to remove all these factors. These exercise, I told you before that these exercise energize that neurotransmitter or form that chemical which will help you directly, physically or mentally. Okay. So what is those all pills are here? Drugs and neurotransmitter. If I talk about, then here also you can see that Prozac used for depression and panic disorders. Same thing can take place through the serotonin neurotransmitters. Okay, so here you can see the serotonin takes serotonin helps in so many kind of problems. So if we have the choice, if we have the option, then why we will go for that drugs? Drugs, always there is a side effect. But if we do physical activity with proper guideline, with proper requirement, with proper guidance, then obviously we don't need any kind of drugs, right? So it's better, it's always better. If we are can solve our problem, then it's always better. So these all are I already told about. The studies and the researchers already established the fact the hormone helps to regulate the appetite, sleep and learning and memory, and it's best known for the contribution in our feelings of well-being. It's done by serotonin. The chemical called is serotonin. Dopamine also, its name is feel-good hormone, dopamine. Here you can see dopamine. If I do daily exercise, daily physical activity for 15 or 20 minutes, then automatically we can achieve that chemical, and we can feel good. Okay, so even you people also can realize that if you go for the walk for a certain time, or do certain kind of exercise in your body, you are feeling better. You will feel better. So I hope that you people have this kind of experience. Endorphin helps you to concentrate and feel sharp for giving assignment. If suppose any kind of exercise has been given to you, if you do regular kind of exercise, regular planned activity, then what will happen? Your concentration level will be increased, and mentally you will very much aware about that particular task, and you will be able to complete that assignment. The study has shown that the average intensity of weekly physical exercise associated with cognitive performance, particularly processing speed, whatever is going on in our mind, the processing speed, whatever information we are getting, how we are processing all this information, memory, mental flexibility. Mental flexibility, I already told about that. Mental flexibility is, am I audible? Hello? Please respond, someone. Hello? Hello?
Audible. Yes, audible.
Yes, audible, clear audible.
Yes,
Okay,
yes.
okay. Particularly the processing speed, memory, mental flexibility, performance in overall cognitive function. Cognitive function is very much important. As far I told you before that cognitive domain is concerned, the cognitive function is also very much important in our daily life. There is one study have been take place. The name of the study was Exercise Intervention in Treatment of Neuropsychological Disease. It was a review study which is published in 2020 in the month of October, and the publisher was Frontiers in Psychology. Here the study shows that the common neuropsychological disease including depression, anxiety disorder, autism, and attention deficit hyperactivity disorder. These all disorder are something different which is managed by the help of the exercise. In many cases, drug therapy is ineffective and bring unwanted side effect. As I told you before, that drug may bring the side effect. Based on the literature, it's concluded that exercise intervention play a positive role, and that certain standard must be established in the field to make the physical activity consistently effective. So, as I told you before, that pills is work over here. It's the pill of exercise is working. The study proved that the exercise is more effective than any kind of drugs for our physical and mental health. Stress and neuropsychological effects, brain loss plasticity with chronic depression. If we have the chronic depression for a longer time, depression, we are depressed about particular incidents or for particular reason, then the plasticity will be disturbed in our mind. So the formation of information or the processing of information will be delayed. Okay. So chronic stress cause increased secretion of cortisol or increased fat deposit in our mind. If we have the long-term stress situation, if we are facing with that stress situation for a longer time, then cortisol level secretion will increase, and the fat, the metabolism process in our body will be hampered, and the fat deposit in our midsection, especially in our belly or in our thighs or just below of our chin. So these all the fats will deposit over here, just only due to the increasement of the secretion of cortisol chemicals. Abdominal fat is more metabolically mobile. greater risk for higher cholesterol level, heart attack, and stroke. So there is a lot of problem you may get just due to the unwanted situation, unwanted secretion of that particular chemicals, cortisol. Abdominal fat will be more. So if the abdominal fat will be more, that means our metabolic system is disturbed. So that time gradually what will be developed in our mind, in our body, greater risk of high cholesterol level, heart attack may take place, or the stroke may take place. Chronic stress increases cortisol, then damage to neuron, then reduce the ability of learn, then increasing, then resulting reduced memory. If the cortisol level is increased, then what will be happen? Neurogenesis, what I told you before. Neurogenesis will not take place in your brain. And what will be happen? Then reduce the ability. Neurogenesis ability will be reduced. And day by day, what will be happen? The information processing system will be hampered. And whatever you want to store in your memory, it will not store properly in your memory. So these all are the factors may take place if you are not aware about the exercise, or if you are not taking the pill of exercise. So these all are the almost same. Chronic stress can decrease cognitive performance by up to 50%. So research study shows that if you have the chronic stress level, then it will hamper your cognitive performance and it will decrease. Whatever you want to learn, whatever you want to attain, you will not accumulate with that. You will not adapt that. So it will directly affect your mind. It will directly affect your behavior. As I told you before, that it's like the psychological aspects is related with your behavior. So it will directly attack your behavior. So exercise, what it do? Exercise raise the stress threshold of neurons in the brain. Raise the stress threshold level. If our threshold level is here, means as far the stress is concerned, if our threshold level is here, if we do regular exercise, our threshold level will be up. Okay, so what will be happen at that time? That time that within certain emotion, we will not feel stress. The stress should have to reach up to that. That time we will get the stress. We will get the bad effect of stress. So if we do regular exercise, our threshold level will increase. Optimize energy used by triggering more insulin receptors, better use of blood glucose and stronger cells. Blood glucose will be more effectively used in our body. Exercise ward off the ill effect of chronic stress and can also reverse symptoms. If I told you, if I talk, just a minute. If I talk about the depression, then exercise regulates all the neurotransmitters targeted by the antidepressants. If we are facing the depression kind of situation, then if we do regular exercise, then neurotransmitter will directly regulate all the antidepressant. So what will be happen? We will engage certain activity which will affect our depression level. Exercise immediately elevates norepinephrine, improves self-esteem, which is one component of depression. Our norepinephrine chemicals or the neurotransmitter will increase after doing exercise, which will directly affect our, one component of depression will be affected by this formation. Exercise immediately elevates norepinephrine, which improves self-esteem. You can understand what you are. You can understand your position. You can understand that what you can do. You can understand yourself. So by the help of exercise, you will understand yourself. Exercise boosts serotonin and dopamine, improves mood and jump start to attention system. So some different will take place in your mind. If you do regular exercise, serotonin and dopamine will increase and it will improve your mind. So exercise and its psychological effects. If I consider some hormonal changes over here, then what will be happen? Just look at that. the effect of exercise on endocrine system might positively affect mental health. Our endocrine system will be affected if it is affected by the exercise, by the help of exercise, that it will affect the mental health. Exercise induced testosterone might increase confidence and libido. Means exercise, if you do regular exercise, our testosterone level will be increased, and which will boost our confidence level, and same time in our biological health, the sex drive or the sex behavior will change. Conversely, low testosterone level might inhibit motivation, self-confidence, concentration level, and memory. If the level of testosterone due to the lack of exercise takes place, then what will be happen? Inhibit motivation level, self-confidence level, concentration level, and memory. Pituitary glands, which is a master glands, pituitary glands may produce a large increase in blood endorphin levels shortly after exercise begins. Okay, so what will actually take place over here? Pituitary glands produce large increase in blood endorphin. So we already told about that what endorphin do in our brain, in our body. Endorphin blocks sensitivity to pain, sensitivity of pain, and can reduce tension or anxiety by inducing the sense of euphoria. So endorphin, as I told you, that it is a feel-good hormone, which will help us to reduce the level of anxiety, and it will give us the sense of euphoria. This is the recommendation of exercise, how we need to take the pill, exercise pill. Already WHO, who had recommended the dose of exercise, that how much exercise, how much pill we have to consume, how much exercise we have to do. Adult age between 18 to 64 years, we should do at least 150 to 300 minutes of moderate intensity aerobic physical activity per week, or at least 75 to 150 minutes of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity activity throughout the week. Okay, so I hope you all understand what I focus on, what I want to tell about the relation between mind and body, and the connection between physiological aspects and the psychological aspects. I just want to thank you with this very nice word of Lord Buddha. He told that to keep the body in good health is duty. Otherwise, we shall not be able to keep our mind strong and clear. So it's a very nice quote. With this quote, I like to thank you all for your patience hearing. If you have any question, then the time is open for you, and the platform is also open for you.
Excellent, excellent, Dr. Hazra ji. Very nice. You have scientifically covered and inspired us. We all are senior doctors here and really mesmerized by your valuable speech. Please, we will be giving trouble to you again and again on every sport day. Don't worry, we are here. So please, all our senior doctors here, professor and head of the department, ex-head of the department, principals, are really mesmerized.
All senior doctors are hearing me.
Dr. Madan sir, are you here in this meeting, sir? Dr. Madan Thangvelu, sir. I would like to request Dr. Agnihotri, sir, for comment.
Okay, thank you. Dr. Madan sir informed in my this WhatsApp account that he was due there in other meeting within 20 minutes. I think he might have gone there. Okay. Well, I was listening Dr. Madhusudan Hazra.
Yes, sir. Madhusudan Hazra, sir.
Madhusudan Hazra. Wonderfully, you completed the whole assignment given to you, right from starting the population medicine, especially the term came to for the first time in my mind, population medicine, and the credit goes to exercise as far as the mental health is concerned. So this was your tagging that what is our population strength and how much our population needs health, that to the mental health as well as the physical health. And the one answer is this, that is the exercise. You completed whole this thing with all your ability and intelligence, not only pertaining to the exercise in the connection of the health, but also you touched all the areas of psychological effect of exercise. This is one thing simultaneously touched by you. So both the things based upon the say master gland pineal, you talked about the good hormones, bad hormones, how they get increased and all that. But to your information and to information of all the persons, do you know that we Ayurvedic persons or we Indian persons are having the great concept of exercise even in the womb? Our fetus itself, it starts exercise in terms of so many things, like cricketing. Whenever he feels that he wants to extend his leg, or he floats in the amniotic fluid. So to get more and more blood circulation to hold of the body for its developmental concept. And as far as the psychological and mental health is concerned, everybody knows the imaginary concept or whatever is regarding the Aimanyu as far as the Chakryu Vedhan is concerned. So mental exercise, physical exercise, exercise in vitro, exercise in vivo, that too in womb life. So that sector is still there, and we always trust one another. I congratulate you for the covering of the whole of the area and to make today a wonderful. Thank you. Pawan Sarji.
Thank you.
Pawan Sarji. Pawan Sarji. Mute, up
Thank
mute.
you very much. Thank you very much, sir. Excellent. बहुत ही अच्छा आपने वक्तव्य दिया मधुसूदन जी. We are really saluting your zeal and knowledge. Thank you, Dr. Sridip, for introduction. Now I would like to request Dr. Aparup Konar, Director of Physical Instruction, Office of the DP, Sports Board, Jadavpur University. Welcome, Dr. Aparup. Now stage is yours. Welcome.
Is it audible? Am I audible?
Yes, clearly. All the best.
First of all, I take this opportunity to thank Dr. Sridhiv Chatterjee and the convener and host of this program for giving me the opportunity to speak before you. So let me go to my slides. Is it visible?
It's okay.
Yes. You can go for slideshow.
Yeah. So respected all dignitaries, eminent speakers, students, parents, ladies and gentlemen, and everyone who are present in this virtual platform. The topic I am going to discuss today, that is exercise as safeguard to immune health. So as we know, to make a healthy living and to get optimum functional health, the host defense has to be strengthened enough. And regular exercise possibly has the potential to enhance the natural immune defense. And moderate level of exercise is one of the most important tool to improve our immune health. So our functional health is depend on our physical health, physiological health, social health, psychological health, and obviously our immune health, because it is the most important component for healthy living and active lifestyle, and it control overall health and the defense against the infection. Now let us see the relationship between the infection, exercise, and immune health. As you know, the resistance to specific infection is strongly associated with effectiveness of immune function. On the other hand, the moderate exercise can influence the immune efficiency and to promote the host against the specific infection, protect the host against the specific infection. Now, there are plenty of benefits of exercise. Exercise can improve our respiratory system, our cardiovascular system, musculoskeletal system, digestive system, and nervous system, and also obviously our immune health system, because it is the integrated system looking for fight by improving post-immune surveillance to promote the overall health. Now, there are 4 major components of exercise for enhancing our immunity. That's endurance or aerobic, strength or resistance, stretching or flexibility, and balance, that is neuromotor. Now let us see the relationship of moderate exercise load, immune response, and infection rates. Now we can see here that, and it is observed that the inactivity results higher infection risks with suppression. Sorry. Yes. So it has been observed that the inactivity results the higher infection risks with suppression of immune response. Similarly, low and the heavy exercise load may increase the infection risk and causes suppress and impair of the immune response. But moderate level of exercise load may lower the infection risk and can enhance our immune response. Now, let's have a look on exercise protocol or preparations. So before participating any type of exercise, we must take care some of the important protocols and preparations that use joint rotations and continuous activity as warming up before 5 to 10 minutes starting the exercise, and do static stretching activities after workout during cooling down period. Then perform all movements slowly, safe, and within a comfortable range of motion. Over a period of several weeks, gradually increase the speed of movement and range of motion. Arrange exercise with the order from standing followed by sitting and the lying positions, and do assisted movements to make exercise much easier and more manageable. So these are very much useful information before participating in any type of exercise. Now let us see the risk and safety tips. So do warming up before performing exercise. Don't overstretch and stretch beyond the point of comfort. At the beginning, do exercise with less number of repetitions and sets. Over 65 years, we should be take care when performing exercise. Exercise should be stopped immediately if signs of chest pain, shortness of breath, palpitation, tiredness, dizziness, etc. Consult with doctor if having any physical or mental problems like heart disease, arthritis, HBP, diabetes, asthma, pregnancy before go for exercise. Don't exercise if having an acute or chronic injury, and perform exercise advised by the doctor. Restrict exercise if having any physical limitations. Can do alternative exercise after consulting a doctor. Don't try to do exercise if having a very poor physical fitness. Start with basic strength and stretching exercise followed by specific exercise. Sufficient recovery using sleep, nutrition, hydration, and psychological strategies. Avoid intensive exercise or over exercising, and less than 10% weekly increment is advisable to avoid the injuries. Let us see the moderate exercise prescription to achieve and maintain health and fitness. The frequency, that is how often, 2 to 3 days per week or 5 days per week is most effective. The intensity, that is how hard, light to moderate, that is 40 to 60% of maximum heart rate. The time of exercise, how long, is 30 to 60 minutes per day, less than 20 minutes per day for sedentary. The volume of exercise, that is the amount of exercise, 150 minutes per week. Repetitions, that how many exercise to be done, that is 8 to 12 repetition of 2 to 4 sets. Type of exercise, the what kind or mode of exercise, that should be involved major muscles group like upper body, lower body, back muscles, and the core muscles. And recovery pattern, that is the interval between exercise or the rest between exercise, that is 30 to 60 seconds between each repetition and 2 to 3 minutes between each set. Now, how would you know that we are doing the moderate intensity exercise? So for doing the moderate intensity exercise, we must see the exercise should be done 40 to 60% of maximum heart rate, or 5 to 7 on a scale of 0 to 10 points, where the 0 is the super easy and the 10 is exhausting. And breathing faster but not hard. When we are doing moderate intensity exercise, make sure that breathing should be faster but not hard. Starting to sweat more during the moderate intensity exercise, and we can able to talk but not able to sing during this moderate intensity exercise. Now coming to the moderate exercise prescription of the aerobic resistance, flexibility, and neuromotor exercise, which is recommended by American College of Sports Medicine guidelines for exercise testing and prescription, 10th edition 2018. Now, these are the components of aerobic exercise, that is the cardiorespiratory endurance. There are a number of components of aerobic exercise like basketball, running, cycling, aerobics. We can do any type of aerobic exercise. Now, let us see the exercise prescription of aerobic exercise. The frequency at least 5 days per week. Intensity should be moderate, that is 40 to 59% of HRR or VO2 max, 30 to 60 minutes per day. And type of aerobic, that is should be the regular. Volume of exercise 150 minutes per week, or 5,400 to 7,900 steps per day. The pattern of aerobic exercise should be one continuous session in one interval, or in multiple sessions in bouts of 10 minutes over the course of a day. And the progression of exercise should be a gradual progression of volume by adjusting duration, frequency, and the intensity. And the examples of aerobic exercise like walking, jogging, running, cycling, cross country, slow dancing, aerobics, rowing, stepping, hiking, downhill, skiing, racket sports, basketball, soccer, etc. Now, coming to the components of resistance exercise, that is the strength exercise. And we can do strength exercise with free weights, stacked weight, machines, and resistance band, like plank exercise, push-ups, multi-gym, using the resistance band and biceps curls. Now, let us see exercise prescription for resistance exercise. The frequency should be 2 to 3 days per week, and that should be alternate days. Intensity should be light to moderate, that is 50%, 1 RM, that is the 1 repetition maximum. And type major muscles group, that is single joint and multi-joint exercise. And repetitions and sets, 8 to 12 repetitions of 2 to 4 sets. And pattern should be 2 to 3 minutes rest intervals between each set. And progression should be a gradual progression of greater resistance and or more repetitions per set, or increasing frequency is recommended. And examples of strength exercises: exercise with free weights, machines, stack weights, resistance band, single joint biceps, leg curl, triceps, quadriceps extension. So these are all the examples of the resistance or the strength exercise. Now this is the components of flexibility or the stretching exercise. There are a number of components of flexibility exercise like Surya Namaskar or sun salutation, Tai Chi, pilates, the Yogasan. Let us see the exercise prescription for flexibility. That is a stretching exercise. The frequency should be 2 to 3 days per week. Intensity, the stretch to the point of feeling tightness. The time 10 to 30 second hold static stretch. Type major muscles, muscle tendon unit. Volume of exercise should be 60 seconds of total stretching time, and pattern 2 to 4 repetitions for each exercise. And progression should be a gradual improvement of range of motion. And these are the examples. Coming to the components of neuromotor exercise, which is consist of the coordination, balance, and agility exercise like skipping, qigong, multi-directional running, and gymnastics. Now let's have a look on the exercise prescription for neuromotor exercise. The frequency should be 2 to 3 days per week. Time 20 to 30 minutes per day. Type exercise involving the motor skills, that is the coordination, balance, agility, and gait. Volume 60 minutes per week. Pattern, no such pattern is there, and progression, there is no such progression. The examples like Tai Chi, yoga, gymnastic, and the program of the exercise should be consist of the warming up, conditioning, cool down, and stretching. 5 to 10 minutes of warming up, 20 to 60 minutes the conditioning per day of aerobic, resistance, neuromotor, or sports activities, and cooling down 5 to 10 minutes of light aerobic and muscular endurance activities, and stretching at least 10 minutes of stretching exercise should be done. Now, let us see the home-based exercise series as recommended by World Health Organization and American College of Sports Medicine, which should be included all 4 major type of exercise, that is endurance, strength, flexibility, and balance. And in home-based exercise series, these are the exercise should be included like lunges, crunches, squats, bridge, planks, and push-ups. And exercise should be involve all cardio, lower and upper body, and the core muscles too. Now let's have a look some sample exercise, home-based exercise, and this is for high knee, and this type of exercise should be done at the beginning for getting warming up, 20 to 30 seconds, 3 to 5 set, and 30 to 60 second rest between set. And this is also very good warming up exercise, that is the jumping jack, that should be done 20 to 30 seconds, 3 to 5 set, and 30 to 60 second rest between set. Then lunges, 20 to 30 seconds, 3 to 5 sets, 30 to 60 second rest between the set. Now this is bicycle crunch, should be done 10 to 15 times, 3 to 5 set, 30 to 60 second rest between the set. This is another important exercise, that is the mountain climber, should be done 1 to 2 minutes, 3 to 5 sets, 30 to 60 second rest between the sets. This is squat, 20 to 30 second, 3 to 5 sets, and 30 to 60 second rest between the sets. Now this is the exercise of bridge, and 10 to 15 times should be done, and 3 to 5 sets, and 30 to 60 second rest between set. And the exercise we are talking about, all this exercise are calculated with the moderate intensity. This is plank push-up, should be done 10 to 15 times, 3 to 5 set, 30 to 60 second rest between the set. This is the exercise of Superman, 20 to 30 times, 3 to 5 set, 30 to 60 second rest between This is dead bug. 20 to 30 seconds should be done. 3 to 5 sets, and same 30 to 60 second rest between set. Side plank with knee lift. It should be done 10 to 15 times and 3 to 5 sets. 30 to 60 second rest between each set. This is plank jack. It should be done 20 to 30 seconds, 3 to 5 sets, and 30 to 60 second rest between the sets. So all these exercises are very useful exercise to enhance our immune system. Russian twist should be done 10 to 15 times, 3 to 5 sets, 30 to 60 second rest between sets. This is very effective exercise, that is Bofi. Should be done 20 to 30 seconds, 3 to 5 sets, 30 to 60 second rest between the sets. Now I'd like to share some of our research work on exercise and sports immunology. This is published in 2005 in Journal of Sports and Sports Science, Immune System, Exercise and Sports Training. In 2017, we have published regular exercise induced changes in human blood urea, calcium, sugar, and some selected hematological parameters in the same journal. In 2009 also, we have published another paper, role of regular yoga practice on some selected physiological health parameters of school-going children in an air polluted area in West Bengal. So, this is the proceedings of International Conference on Global Climate Changes. The name of paper is the Assessment of Cellular Health among Exercise and Non-Exercise, Exerciser and Non-Exerciser induced by air pollution. This one, the air pollution induced changes in the physiological health of healthy sports participants. This is in American Journal of Sports Science and comparative study of lung function test between physically trained and untrained adults. And in the International Journal of Nutrition and Food Science, vitamin D, optimal health and athletic performance, a review study. So in the International Journal of Physical Education, Sports and Health, one paper is published titled Exercise-Induced T-cell Variation in an Air Polluted Area, a case study. This is in Springer, published in the Springer, changes in immune response to moderate exercise in active trainees. And very recent, we have published a paper as a book chapter, Healthcare Waste Management and COVID-19 Pandemic, which has already been accepted. Exercise in immune health management and rehabilitation against COVID-19. So let's take a place, do exercise, be healthy and fit, and keep our immunity high. Thank you for your patience hearing.
Very nice, Dr. Konar. Very nice, impressive. And you all are expert of a science, no doubt. You are scientifically presenting everything. And this is worth listening and worth inspiring for us. Agnihotri sir. आप म्यूट हैं सर.
Thank you, thank you. Really, it's a great pleasure that whatever the topic you took up or whatever the day we celebrate, it contains to exercise and execute the whole of the hidden facts which the experts only can reveal out. So by now, two guest speakers has given their thoughts. The idea is very good. And as far as our Dr. Aparup Konar is concerned, first of all, his name is wonderful. Right from the roots of Aparup, wonderful. Gives the impact of the Bengalis accent and all that. So he, at which point he was different to the previous speaker. Fact is this, that he also incorporated under the heading of exercise the stretch exercises, and there came the yogic exercises, including the Surya Namaskar. This is one thing I liked it, and moreover, as we know that WHO is the no doubt competent authority to decide each and every action pertaining to the health, but still we are free to decide that the person who is going to follow a special package of exercise as per his own need, desire, and tolerance. It is not necessary that whatever they have given, it should be in terms of the numbers or duration be followed. So goes the case with the Ayurvedic concept. We say Ardhabal, Balardhen Kartavyo Hanyato Anitha. We are supposed to exhaust our energy up to half of the strength. Moreover, 3 stages are there. One is supposed to reduce the weight, one is supposed to reduce the fat, and the other one is there to develop the stamina. In these connections, the exercise package will be decided. So goes the case with the food. Diet is also to be decided. So this is wonderful, very good submission, and still things are there which we can put in our question hours. So thank you, congrats. Thank you. Sharma ji.
Thank you, sir. Thank you very much. Thank you, Konar साहब. बहुत अच्छा आप बोले.
Thank you, sir.
Thank you, श्रीदेव जी और पुनीत जी को नमस्कार. बहुत अच्छे वक्ता आज आप लोगों ने इंट्रोड्यूस किए. मैं आपको तहे दिल से शुक्रिया अदा करता हूं. और मिस्टर पलाश प्रामाणिक, he is PhD scholar, research scholar, UGC National Fellow, Department of PE, Physical Education, Jadavpur University, Kolkata. Welcome, Dr. Palash. Now stage is yours.
Am I audible, sir?
Yes, clear.
Okay. Good evening to all the speakers and all the participants. My heartiest gratitude, Dr. Sridhiv Chatterjee sir and Dr. Pawan Kumar Sharma sir. I am Palash Pramanik, PhD research scholar, Department of Physical Education, Jadavpur University. Today, I am going to present a topic, Science of Yoga for Health and Wellness. Okay. Now I am sharing my slide. Is it visible? Sir, is it visible?
Yes, clearly.
Okay. Again, I am sharing my topic, Science of Yoga for Health and Wellness. Okay. All you know that health is not everything, but without health, everything is nothing, right? What is health? The absence in general, the absence of both physical and mental diseases is called health. According to WHO, health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Okay? And what is the wellness? Wellness is a process or it is a state of living a healthy lifestyle. In this picture, suppose you hold a normal health. You have two probability. You may go towards the ill health or death, or you may go towards good health or wellness. Choice is yours. If you achieve wellness, you must practice the holistic approach of life. How? Now, by balancing your body, mind, and spirit. Okay. Next. Now the question is, how to live well through yoga? Okay. Yoga is a holistic science of life which deals with physical, mental, emotional, and spiritual health. So we can use yoga as a health and wellness guidebook, right? There are various aspects in yoga that help preventing and managing diseases and contribute to good health and happiness. Panchakosha is one of the most important aspects. What is Panchakosha? The concept of Panchakosha has taken from the Pituitary Upanishad. We are made up of Panchakosha, the 5 layers of existence. By developing Panchakosha, we can develop our health. Okay. Next. Panchakosha. What are they? They are Annamaya Kosha, Pranamaya Kosha, Monomer Kosha, Vijnanamaya Kosha, and Anandamaya Kosha. Annamaya Kosha is also called physical body or gross body. Pranamaya Kosha is called vital body. Monomer Kosha is called mental body. Vijnanamaya Kosha is called intellectual body. Pranamaya, Monomaya, and Vijnanamaya Kosha is under the subtle body. And last one is Anandamaya Kosha. It is also called spiritual body or bliss body. Here, these 5 layers are telescoped into one another. Okay. Next. Annamaya Kosha, gross body. Annamaya Kosha. From earth comes herb. From herbs comes food. From food, human body was made. So we can say man is a transformation of the essence of food, right? Everything that we experience through our indriyas is a part of physical layer. The Annamaya Kosha, we can see, we can observe, we can touch. Okay. Next, how shall we develop the Annamaya Kosha? We can develop Annamaya Kosha by diet, exercises, asanas, and kriyas. Okay. Which type of diet? Sattvic diet, yogic diet is also preferred for development of Annamaya Kosha. How it works? Diet transform or makes our muscles, our veins, our nerves, our blood, and our bones. It also removes our different elements, physical elements. Next, exercise. Exercise affects our physical body. How? It develops our joint mobility, relaxes our muscles, improves our power, and develops our stamina. Okay. Next, asana. How asana develops our Annamaya Kosha? Asana, through Yogasana, we can achieve our physical revitalization, our physical relaxation. Okay. Next is Kriyaj. How Kriya works to develop our Annamaya Kosha. Kriyaj cleans our internal organs, it tuning up our different systems, it develops our internal awareness, right? Next, Pranamaya Kosha, the vital body, or it is also called pranic energy body, our self, which is made up of vital force. There are 5 components in Pranamaya Kosha. What are they? They are prana, apana, samana, vyana, and udana. All are related in our 5 physiological systems described in Ayurveda. Prana, how they work? Prana is the faculty of perception. Prana is the faculty of perception. It controls our sense organ. Next, apana. It relates to excretion, such as urine, feces, respiration, etc. Samana, it relates with digestion. It digests our foods, which are collected in our stomach. Last is vyana. It relates with circulation. The vyana conveys the nutrients to the whole body through the blood. And last one is udana. It relates with thinking. Next, how do we develop our Pranamaya Kosha? We develop our Pranamaya Kosha by practicing pranayama and different types of cardiac sports and games. Okay. How pranayama works? The proper breathing practice helps to remove the random agitation in pranic energy flow. Okay. Next, sports and games. Different types of games and sports develops our Pranamaya Kosha, pranic energy. Okay. Next, Monomer Kosha, mental body or mental set. It is the mind stuff. It is also called Chitta. The Monomer Kosha receives all the sensory inputs. This is the more powerful than Annamaya Kosha and Pranamaya Kosha. The Monomer Kosha includes 3 types of functions. One is thinking, second one is feelings, and last one is willing. Okay. Next, how to develop Monomer Kosha? We can develop our Monomer Kosha by practicing pratyahara, dharana, mindfulness practice or meditation, prayer, and mantra chanting. Pratyahara, withdrawal of all the senses from the outer object, we can control our mind. Next is dharana, focusing the mind on a particular object or images, we can control our mind. Next, mindful practice. It may be transcendental meditation or any other meditation. That meditation helps to calm down our mind. It tranquils our mind. Prayer. Prayer calms down our mind. It controls our emotion. Next, mantra chanting. Mantra. Manana trayate iti mantra. Mantra means that control our mind. Repeated mantra chanting, putting useful and positive information in our mind. Okay. Next, Vijnanamaya Kosha, intellectual body. The intellectual stuff, the self consisting of Vijnana or knowledge, which is very subtle and sharp than the Annamaya Kosha, Pranamaya Kosha, and Monomer Kosha. The intellect, that means buddhi, is the discriminating and discerning process which examines and judges the stimuli received by the mind. Vijnanamaya Kosha guide us to discriminate what is good and bad, what is right and wrong, what is useful and not useful. Okay. How will we develop our Vijnanamaya Kosha? By practicing dhyan, shraddha, knowledge, nishkam karma, service to others, and completely fills your insight, we can control, we can manage, we can develop our Vijnanamaya Kosha. Shraddha, that means self-study. Nishkam karma, selfless work, that helps to develop our Vijnanamaya Kosha. Next, Anandamaya Kosha, spiritual body. Our self made of bliss. This is the most subtle aspect of our existence. This kosha is called causal body or Karan Sharira. When all the other koshas are well developed, we experience harmony between inner self and other world. This harmony gives us a sense of joy and bliss. Experience extreme happiness and contentment. Qualities of positive health and wellness. How will you understand positive health and wellness? There are some symptoms are there for positive health. Lightness of the body. It is one of the most symptom for positive health and wellness. Luster on the face. Clarity of the voice. Brightness of the eyes. Thirstlessness of the mind. Freedom from disease. Stimulation of the gastric heat. Purification of subtle energy channels. All are the symptoms for positive health and wellness. Next, conclusions. Yogic life does not mean you always have to do meditation. You also do the creative work with joy, without attachment. Practice right type of ahar, vichar, ahar, and bihar. Have a sattvic life mixed with friends and family. Maintain a balance between work and rest. Have your own personal time. Ishvara Pranidhana give you a additional support. Do not bore over past and future. Enjoy the present moment, present situation. Pursue the right purpose and meaning of life. Always say, I am happy. Always say, I am happy. All powerful and the limitless. Laugh, serve, meditate, and be free. Okay. Thank you all.
ग्रेट ग्रेट. आप तीनों स्पीकर्स रियली आज बिल्कुल आपने जिस अंदाज में मनोमय कोश, और मैं इसीलिए अब जादवपुर यूनिवर्सिटी में तो मैं भी आप लोगों के साथ चला आता हूँ श्रीदीप जी की दया से. श्रीदीप जी जिंदाबाद. थैंक यू थैंक यू थैंक यू पलाश जी.
Thank you,
और
sir.
सबसे बड़ा थैंक यू श्रीदीप जी को, मैं दिल से उनको शुक्रिया अदा करता हूं कि आज की वेबिनार में जितना साइंटिफिक हम लोगों को सुनने को मिला, उससे आत्मा तृप्त हुई, आत्मा संतुष्ट हुई कि यस, वी आर डूइंग सो मच इन आवर इंडिया टू प्रूव अवर सेल्फ दैट वी आर हियर. मैं मदन सर से आग्रह करूंगा, मदन सर हैं, डॉक्टर मदन सर, am I audible to you, Madan sir? Now I would like to request Dr. V.K. Agnihotri ji for his comments, and if any question is there from anybody, we will be inviting. Speakers are with us, and really thank you to all speakers, Dr. Sridip, Dr. Madhusudan Hazra ji, Dr. Aparup ji, and Mr. Palash. Thank you. Agnihotri sir. Agnihotri sir is former professor and head of the Department of Hygiene in Haridwar, Uttarakhand Ayurveda University. So, Agnihotri sir.
थैंक यू सर. नमस्कार शर्मा जी. अभी हम पलाश जी को सुन रहे थे, और बड़ी अच्छी बात है कि हमारे तीनों स्पीकर्स ने एक ही टॉपिक होने के बावजूद अलग अलग पक्षों को लिया, और इनकी विशेषता ये रही कि इन्होंने जो हमारा पंचकोश का सिद्धांत है उसको प्रायोरिटी पे रखा, ये सोच के कि हम क्यों ना बात कर ले अपना एक मेंटल हेल्थ के मामले में, क्योंकि मेंटल हेल्थ भी हमें प्राप्त होती है, क्योंकि मेंटल फैटिग भी होती है, मेंटल एक्सरसाइज भी होती है. जब हम किसी उलझन में फंस जाते हैं तो बहुत कुछ हम दिमाग को जोड़ डालते हैं, सोचते हैं इसका क्या समाधान निकलेगा, इसके लिए हमें एक सिटिंग पोस्चर में बैठना पड़ता है या मेडिटेशन में बैठना पड़ता है. तो वो फिजिकल एक्टिविटी एक्सरसाइज तो नहीं होती है, मेंटल एक्सरसाइज बहुत होती है, और तब जाके कुछ आउट ऑफ सम ध्यान, सम कंसंट्रेशन कुछ बनती बात. तो इन्होंने इस चीज को उठाने की बात रखी कि भले ही हम जो मनोमय कोश है या जो हम ध्यान के पास पहुंचेंगे, उससे पहले हमारा जो ग्रॉस बॉडी है वो तो हमारा अन्नमय कोश और अन्न के द्वारा ही बनता है. तो बड़ा अच्छा टैगिंग किया, इस चीज को उन्होंने तो अपनी बात कह दी, और हम लोग हैं इस चीज को उस ढंग से समझने के लिए, तो बड़ा अच्छा किया कि अन्नमय कोश की प्रतिस्थापना करते हुए सात्विक अन्न की सहायता से जब हम अपने शरीर का निर्माण करेंगे, उससे जुड़े हुए हमारे जो अन्य कोश है वो क्रमागत तरीके से डेवलप होते चले जाएंगे, और अंत में हम उस मेंटल एक्सरसाइज का अपने बॉडी के द्वारा एक पार्ट बना के निश्चित रूप से आनंदमय कोश तक प्राप्त होने वाले जो ब्लिसफुलनेस की जो कंडीशन है वहां तक ले जा पाएंगे. बड़ा क्लिष्ट विषय भी है, और एक सटल माइंड से देखा जाए तो फिजिकल एक्सरसाइज से मेंटल एक्सरसाइज की तरफ आपने जो हाईलाइट किया है, एंड दैट टू विद द हेल्प ऑफ द डाइट which is directly means consumed by body. So this body is developed to the mental status, and the soul will also be involved, and we will reach to the destination established by our yogic practitioners or our yoga shastris. So thank you so much. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you very much. Now I would like to request, we are fortunate that we have Srivastava ji. Srivastava ji, welcome. Welcome, sir. Very renowned dignitary, and means सूर्य को दिया दिखाने की मैं हिमाकत नहीं कर सकता. I can't show Deepak to sun. So welcome, sir. Welcome, sir.
Namaste, sir. Namaste. Namaste. I would like to take an excuse actually, because I was traveling, and because I want to keep in touch, I was entering in between and then leaving. So I could only hear part by part. But now what I heard Dr. Agnihotri sir telling, then it has summed up everything. And such a brilliant conclusion and such a vast knowledge you are having, sir, regarding the what you call the Indian sciences as well as the modern sciences. So
kind of you.
Told of this one. Anyway, this is I would like the inputs from, I will be surely listening to the whole, this program again. And I had actually, Pavanji, I had Sharmaji, I had shared this with the group of the Sports Ayurveda Authority of India, Trivandrum people. who had whom we had conducted who had conducted a yoga and Ayurveda contribution for sports medicine in sports health and exercises. So that is they were also, I don't know whether somebody entered from there, but I had shared that, and I will be sharing the YouTube link also to them so that can be pursued, and they will be also
Thank
happy
you, sir.
for.
Blessings, your blessings.
And one more thing is that regarding the Ayurvedic concepts of Vyayama, I think that is very much it is sometimes quoted, but many times it is neglected. Like the role of Vyayama, how to what extent, in what season, how much, for what Prakriti people, how much, etc. It is a very, very detailed Shastra, which we are talking very much about the food, we are talking about other things, but we have not talked too much about regarding this Vyayama. So Vyayama, when we are seeing that it can be according to the, when we tell about the exercise therapy, whether they are exercise therapy in Ayurveda, many people shrink their eyebrows. No, it is not there like that, they tell. But when we go through the lines of the textbook, we can see that how Vyayama is important in the keeping the samatva of Vata by increasing the Agni whenever it is needed, as well as to control the Medas and the Kaba whenever it is, so that the Sama Pravarti of the Vata is maintained in the body. So this is very much interesting area only. Thank you very much for again giving me a chance. I think that whenever I am there, I am happy to, but I am not a scholar in all the subjects. I am trying to learn, and every opportunity Dr. Pawan Sharma creates, I don't want to miss also. Thank you very much. Madanji, if he is there, very good evening.
So nice of you. So nice of you, sir. So nice of you. Your blessings are always required, sir. Please
Sure.
bless us.
I am always in touch, and I will be
Thank
doing.
you, sir.
It is my mission. I told no, like Marma Pracharana is a mission. So when I get connected with more and more people, and with the encouragement given by Dr. Madan Tangavelu and all, even while introducing very graciously, I am very happy only to be sharing my opinion and knowledge. Thank you.
Thank you. Thank you, sir. Thank you very much.
Sir, may I have half a minute just to appreciate the concept given by Sivas sir? Actually, as you told that there is something as far as the exercise or Vyayam is concerned in Ayurveda. It's factual. Our two great scholars are there. One is Acharya Charak and one Acharya Sushruta. When on one hand, Acharya Charak says that Sharir Cheshta Ya Cheshta Isthya Artha Valvardhani De Vyayam Sankyata Matratam Samachrit. He is talking about the exercise in that too in a form of the result orientation. Any activity which leads to the strength and stability. Yeah, Sthirya Artha Balvardhini. At one time, it should give the stability to the body, and on other hand, it should strengthen the body. While as Acharya Shushu says, Deham Vishvate Yasmat Tasmat Saryas Jankam Karmam Vyayam Sasangitam. The activities which leads to fatigue to the body is known as exercise. Means not a matter of that good output like Acharya Charaka. Deyam Vishmate Yasmat Saryas Jankam Karmam Vyayam Iti Sangikam. Activities which gives the tiredness, thakan, that is known as exercise. So we have to take out the essence from both the definitions for the greater concept of the establishment of health of every exerciser, every doer. Thank you, sir.
This is very good, very important aspect, because in sports we see that overtraining is also affects the performance. It should be samyak.
Yeah.
It should be samyak.
It should be samyak. At the end, इंद्रियों का अत्योग, अयोग, मिथ्या योग तीनों ही मना किए गए हैं. In that way, we should be samyak, coordinated, equilibrium, balanced.
And we have to know that it is one among the Saptavida Shamana Chikitsas in Langara.
Exactly.
Evanam Pajanam, Vyayamam, Atapa Sevanam, Marada Sevanam. So, Vyayama, it also, as you told, we have to study it very well with the Ati Yoga, Hina Yoga, Mithya Yoga.
Actually, with the concept of the food and digestion, Langanam, Am Pachanam. So if the arm will be there, there will be Mandagni and there will be Alasya. One will not motivate himself for going exercise. So Langanam Am Pachanam, then we can go for the exercise like that.
And Prameha Chikitsa also it is. When Krisha Pramehi is there and Stula Pramehi is there, what is the sort of Vyayama which has to be?
It is a must. It is a must for at least 2 to 5 kilometers.
Also, when it is a speed-based sports, or when it is a stamina-based sports, or this one endurance-based sports, then a Vyayama changes.
Our Acharya told this. They Vyayam Sankhya. Either you do for the uplifting of weight or sit-ups in Sankhya, in number, or you go for the covering 2 kilometers, 3 kilometers. Vyayam Sankhya, they Vyayam Sankhya, Matryatam Socha, either in number or in quantity.
Yeah.
They have given both the parameters for assessing oneself, that how much he has consumed the calorie and how much fatigue he has got. Say, coming out the perspiration over the tip of the nose. These are the parameters where we have to stop. Shallow breathing, perspiration or presence of sweating in the axillary region. These are the parameters. So in that way, go for exercise, but we should know where we have to stop. Very good concept.
I think even the director, vice chancellor of National Institute of Ayurveda will be very interested because the Marmology and Sports Ayurveda diploma, MSc diploma course has been started now in National Institute of Ayurveda. Yes. And no, 2 seats are this one, and I'm happy to that I am an expert.
If you sir appreciate and recommend, definitely we will get the better tomorrow. Definitely.
Yeah.
Thank you, sir. Thank you.
I would like Sharma ji.
Welcome.
Yes, actually, I was listening to both of them. It's a great experience. Actually, we have already worked on this particular area, science of exercise in ancient Indian text. This paper is available in the PubMed, and we have categorically point out the different aspect of exercise, as both the sirs already explained the things very well. Different definition of exercise, ati vyayama, and the different session when we should go for vyayama and where we have to stop. All those things categorically has been explained. Yes, definitely in vyayama, but that the things has already been told by both of the eminent person. But my I would like to share one view, that is all this system actually developed from a theory. That means 2 theory we may be identified. If we go through the history of medicine, there we will find 2, probably you people all from Ayurveda field, probably these things are known to you all, that Vata Pitta Kapha, that means this Tridosha theory, and in Greek civilization that one extra component has been added over there, that is blood. So 3 component in Indian theory, and when it is explained by Greek people from Hippocratean time, it is 4. So there is nothing much difference between the 2 approach, and these 2 are most ancient one. And one thing I would like to share because this is the very good platform. If we able to introduce Yog Vyayama, I used to use this particular combination, Yog Vyayama. Even in some years ago, I used this terminology in different seminars, conference, in my different writings, Yog Vyayama, because we have already seen there are different aphorisms in different ancient texts clearly mentioned. Yoga is for mental body, Vyama is for physical body. If we are able to create a balance between these two, then that would be the best option for health and wellness. Today we are talking about wellness, but that the more higher concept has already been explained in Ayurveda in terms of positive health, because the term positive health has been used in Ayurveda first, and whole world copy from this Ayurveda. Thank you.
Okay. I would just like to put in one more opinion, Agnihotriji, that now there is the active exercise and passive exercise concept.
Yes.
Is it not? So whatever the, hello?
Yes, sir, I am listening. Yes, sir.
Yeah. The Udvartana and Utsadhana and the massage therapy, as has been told. We can see that according to season also, it is now a massage is something which is a very passive exercise for the body, for the tissues of the body. And this we can see that right from Utsadhana, that is Samvahana, to Padhagada, it is there. We can see that in Vada Chikitsa, it is so. That is why in Kerala, this Kalari Urichal or the Marma Abhyanga is very, very well used tool for dealing with the Srodoroda and correcting the Srodoroda and giving Saukya. So that is why the massage is also termed into 3 types. And this is a type, we have to understand that that is a type of Vyayama, which is not the active type, but the passive type. It is given by the giver and the receiver receives it. And the giver determines the rate, rhythm, force, pressure, and all to make the changes in the doshas, whether it is for Vata or whether it is for Kapha, whether it is remove the Srodhas or channelize the Srodhasas, Prana in the Srodhasas, whether to remove any Sangha in the Marmasthanas, or to enrich, energize either Prinanam or Jivanam, which has to be done through the Siras, by correcting the Siras. So, therapeutic, the massage itself is, you see that there is the Sukha Thirumal, we call it, for maintaining the good health. The Kacha Thirumal, we call it for preparing the sports person or the person for performance. And there is the Raksha Thirumal, which is the therapeutic massage. So exercise again, the passive exercise again can be divided into hygienic, therapeutic, and what do you call, health oriented. So wellness oriented. So we have a lot of things to talk, and each one contributing, we can come out with a very good. Now also there are some books, as I'm very glad that friend told about the article published, and I will look into it also. So thank you very much again.
Sir, as
if you have any recommendation for government projects, sir, Dr. Sridip Chatterjee is the head of the Department of Yoga section. He is running yoga course, PG diploma in yoga course, and with this collaboration from Haridwar, from South, wherever. In Bengal, this is necessary, sir, because the awareness is at the lower level. So it should be. I'm really thankful to all.
I am completely agree with Sharmaji. The awareness regarding yoga, Vyama, and Ayurveda, really we are really in a very dark situation. There was a huge intellectual people from Bengal, but right now, last 50 years, really we are in a dark age. So I am ready to collaborate or ready to work with you all. If there is any scope, we can develop exercise as a population medicine. Definitely there will be different part. Yoga is another part, Vyama is another part, and I am very much interested to work with Vyama, because there are many work has already been done. You probably heard the name AC, American College of Sports Medicine. They lot of work has already been done, and if you see Aparup Konar rightly stated all those works in his speech. But we have to work on Vyama to revive it, to introduce this to the society. We have to work together. Thank you, sir, to raise this particular proposal in this forum. Thank you, sir.
Shiva sir, one very important point which you raised, that in a form of udvartan or massage, it can be considered as a passive, say, exercise. Can't we read in between the lines that if we perform massage by my own, it will be active exercise. If we go for udvartan by my own, it will be active exercise. And if I get massaged by other person, that will be a passive exercise, and so will be the udvartan by other person. And that's why it is always said that the instructor is always much more benefited, because he give instructions along with some practical demonstration repeatedly to all the A, B, C, D groups, right from 6 a.m. to 10 a.m. So goes the case with the massager. A massager is always having a very good muscles, because he is making 2-3 persons massage daily, full body massage, or as per the case of the paralysis or anything. So active and passive concept may also be attained by the doer himself or the performer performed by others. This is in between the lines. You can appreciate it. Thank you.
Yeah. That is what we tell them. We Marma physicians, we don't write Abhyanga on the paper for the therapy assistant to do. We become the therapist. And that is why we are more successful.
That's why this point came in my mind, that it should also be taken into consideration, that we do it, and as far as the oil pouring in the ears are concerned, in the nostrils are concerned, in the umbilical is concerned, we perform by my own on every Saturdays. So goes the case with the exercise. So I am active and actively performing massage for my own self. This is what I wanted to summarize. Thank you.
Sure. That is a tool for Vyayama.
Excellent, sir. Like to invite Dr. Jayesh Thakkar of Jai Ayurveda. After that, I will request Dr. Vishnu Prasad Sharma ji, former principal, Guwahati Ayurvedic College, Assam. Welcome, Dr. Jayesh. Would you like to add anything?
Yeah, welcome, sir. Thank you for the, sir, actually, for welcoming, we have many dignities. And when coming to sports, sometimes I feel it differently. Say, am I audible?
Clear.
Yeah. So two things are in my mind. One, when it was for sports for peace and development, when it was the theme of the day, I was wondering whether how to include the competition spirit between different nations and different people to bring the mental peace, which is the need of the time. Earlier days also, there were different like horse riding or different forms of activities and sports. So we should not restrict ourselves to only some limitations. This is something which is coming in my mind. Second is when we try to say as in yoga or as an exercise, one exercise cannot fit for all. Like one shirt or one size doesn't fit all. I also think for Vata Prakriti, Pitta and Kapha, there should be some basis to decide which sport is good for which type of person. And we should make the Prakriti analysis in school level or at different institutions sports level to select which sport is good for which type of Prakriti. And if that is included, we can get the maximum benefit of it. And that will be indeed a collaboration between all the studies which are going on. That is the little input from my side. And it was a very good discussion from all the speakers and everybody. Thank you.
Very nice, Dr. Jayesh. You have opened new avenue. In my opinion, this should be started at gyms. Wherever gym is there, they should exercise according to their prakriti and their capability and stamina. Really excellent, nice suggestion, very nice. Now I would like to request Professor Vishnu Prasad Sharma ji. My question is this, sir. Sridip ji is here, Dr. Aparup ji is here, Dr. Madhusudan ji is here. Whether we can spread our wings to Northeast, as you are the senior most dignitary in Northeast. So you are the former principal of Ayurvedic College. Whether we can start any project, collaborative project with Jadavpur University, Department of Jadavpur University, Physical Education or Yoga Department. So we can create, because this is very necessary in our Northeastern zone. Eastern and Northeastern both. Welcome, sir.
Yes, thank you, Pawan Kumar Sharma ji. Yes, today's seminar was very wonderful. All the eminent speaker has delivered their lecture and gave very good suggestion. And I am agree with you. Yes, we can do collaborative research work with Jadavpur University. No problem. No problem. In Northeastern region is a backward place. So we can develop, and mental health is required. But nowadays in all over the world, we have to maintain the mental health. And this is only possible with the help of Ayurveda, yoga, and this thing. Yoga is required, exercise is required. Yes, we can do collaborative research work, no problem. From my side, I will help you, no problem. With these few words, I conclude my lecture. Thank you to all. Namaskar. Your voice is not there.
Thank you very much, sir, for your blessings. Thank you very much. So now,
thank you, sir. Also from my end, also thank you very much for your acceptance and spread your hand.
You have great. Hats off to you, Sridip ji, Aparup ji, Madhusudan ji, because you have ignited a new wing in our AYUSH SAMRIDDHI. Definitely, I would like to travel you again and again on 10 or 15 days in the year, because it is very unique thing that one day, every day is being celebrated with 10 or 15 names. So we are relating with our AYUSH. Yoga is also component of AYUSH. AYUSH is not complete with you, without you. So thanks Sridip ji for introducing such nice speakers and for your collaboration. Definitely we will try from central government also. If any project is there, we have our relations in central ministry and we can go ahead for that. Thank you Srijit ji. Dr. Madan Thangwalu sir, are you here with us? Otherwise, Jagdishwar sir, welcome sir. Adharaniya Dr. Jagdishwar ji from Telangana, welcome. This AYUSH SAMRIDDHI platform is really spreaded in being all over the India in within 20 countries. So please join. Tomorrow is World Health Day and we are celebrating World Health Day with us. 3 speakers will be there for holistic health through AYUSH by AYUSH. Thank you, sir. Thank you, Jagdishwar.
दादाजी नमस्कार, सब लोगों को मेरा विनम्र प्रणाम। यहाँ पर 2 चीज का अंतर मैं देखता हूँ, एक व्यायाम और दूसरा जो आसन योगा में आता है, व्यायाम योगा में नहीं आता है। और पता नहीं इसके बारे में दोनों का क्या कैरेक्टरिस्टिक है, बताएं तो जनरली very rare distinguishing is there. Am I audible, Dadaji?
Clear, sir. Clear, sir.
Yes, sir. You are audible. You are audible.
Thank you, Sridip ji. एक चीज मुझे बताइए what is the characteristic of asana and what is the characteristic of
In single
exercise?
single line, asana is very much static in nature. What does it mean by static? Because this particular term we used, when we use this in biological science, it actually entered into the biological science from physics. Physics through mechanics, and from mechanics to biological science. Static in nature, there are two types of exercise. Broadly, if we talking about exercise, there are two types of exercise. One is static one, another one is dynamic one. So static one is very much, asana is similar to static one, but another difference is there. In asana, the mental aspect is very much important with the physical aspect. That is absent in exercise. Being a man from exercise field, as well as I also study yoga, then I could understand in that way, asana is very much concentrating on psychophysiological health, whereas exercise is very much concerned about musculoskeletal and cardiorespiratory health. So if we are able to create a balance, because when we are talking about sports means, I wanted to mean sports as a when I am talking about competitive sports, when our objective is to achieve the top performance, then we have to combine these two. And if you see the world, the people of other countries, means I am talking about advanced countries, they already included yoga trainer in their national sports teams and in their sports person. But we in India still are in dilemma whether yoga can be included in the performance sports or not. But the difference is quite quite distinct. Exercise is very much physical in nature, whereas asana, it has the physical component, but it has the mental component also. If I distinguish in that way, yoga is for mental, asana is more related with, for 60% related with mental body, 40% related with physical body, whereas exercise 60% related with physical body, 40% related with mental body. We may distinguish in that way. Thank you.
थैंक यू श्रीदेव जी. एक बात तो ठीक क्लैरिटी आया इन टर्म्स ऑफ मॉडर्न असेसमेंट. इसके लिए एक डेफिनेशन में आराम से सब लोग समझते हैं कि asanas are meant for glandular regulation, secretion regulation, and exercise is the thing put to work to musculoskeletal, what you have mentioned in your explanation. And here, if you go through both characteristic, one should be mentally be perfect. I do not say that physically should not be. Asanas at the same time performed physically, but at the same time developing every kosha. And here also what koshas have referred, out of them also who will be much in understanding consciously, I do not know. Koshas are always referred 5 for unit mind. They are Kamamaya Kosha, Monomer Kosha, Atimanasamaya Kosha, Vijnanamaya Kosha, Hiranyamaya Kosha. In most of the speakers' interpretation, I had gone through and I was very audible to it, that where Anandamaya is referred, I do not know. For this thing also, I give a reference from Ishavas Upanishad. Hiranyamaya Kosha Pare Atmastitihi. There it is not mentioned that Anandamaya Pare Atmastitihi. About Hiranyamaya, there is nothing. It is the existence of Atman. And likely here, even in the below lower stage, koshas are meant for mental activity. If anybody asks, a lab assistant asks that, please show me in the body it becomes a mere foolishness asking, because they are not the layers which can be put in the lab and can be visualized. They are the characteristics. Koshas are always mental characteristics and performances and controls. Through that only, likely, another side, I will give that, where we are talking about Anda, unit mind, Brahmanda. For Brahmanda, Sapta Lokatmakam Brahma Manaha. How they are termed as lokas and how this is termed as koshas, it becomes a different aspect of philosophy, where it takes a lot of time for explanation. But only for Brahmamana, they are saptalokas, bhu, bhuva, swa, jana, tapaha, satyaha. Like that, there are saptalokatmakam, maha, jana, tapa, सत्य. तो यहां पर 7 लोक आए, यहां पर 5 कोश आए. तो ये जो है ना एक कंपैरेटिव स्टडी है. वहां भी लोकास सप्तलोकात्मकम और बोले वो लोकास को भी हम दिखा नहीं सकते हैं, बट they are controlled in the universe by Brahmamana, cosmic mind. And whereas the reference of subject which we are just put up in this, why yoga teachers are not being included in India, that is Bharat. Bharat has become so, I think that in this you have used Sridip ji, static. Static, if it is termed, there will not be dynamicity. Static in a broader sense becomes that it has become inert. But always asanas are dynamic. And at the same time, you have to think very thoroughly. My bitter comment will be to the atmosphere prevailing in Bharat, that these people for everything thinks that in a religious perspective. They think for a while. If we include yoga, whether it will be a debate for another sections, becomes a religious one, nonsensical thing is prevailing in Bharat. Though the culture of Bharat is different, the heritage of Bharat is different, it is totally negligible here in the prevalent situation. That is why yoga teachers are not being included immediately. Why? The other countries are very interested towards yoga, but why these nonsense people are not vigilant towards yoga? How long time? Was it a thing brought from Greece or Italy or somewhere? Nothing. It is the heritage of India only, Bharat only. But they have not brought up. And even to think about, even to discuss about Yamanema also, it becomes a hesitating thing. Because ahimsa satya astya aparigraha brahmacharya shanta shaucha tapas swadhyaya ishvara pranidhana. Let anybody come forward who are nowadays being termed. If you go to a primary school also, if you ask that who is the authority of yoga, they will put up some name which is on media only. Are these masters who had not spelled out of Ashtanga Yoga Yamaniyama? Even they do not know what characteristics of different aspects of these. And let a broader explanation will be. Even they are not at the depth of their brain, even I say. But they have been in the media. But how it is lost? Why the original text is being lost? Either in Ashtanga Yoga Patanjali's or the yoga, if we go back to beyond Patanjali, he is the authority. Who is the authority of yoga? Tell me. Authority of yoga is Sadashiva. None else. Even Patanjali comes after. Do anybody know that authority of yoga is Yogeshwara? Yogeshwara, if you take to references, even in Bhagavad Gita, Yogeshwara is being called term to Sri Krishna. None else. Why these people are only called, why Rama was not being termed as Yogeshwara? He was called as Uttama Purusha, not Yogeshwara. Why? Because these two characters are Taraka Brahmas. Then if I term that Taraka Brahma, again it becomes a big havoc. Where is the reference? Taraka Brahma is a reference in Tantras. तब यहाँ पर योगा के बारे में बोले, योगा के बारे में पुटअप करे तो he even out of the population of India, Bharat, very meager, maybe something having information or knowledge about who is Yogeshwara. Likely, we have lost all heritage. Only we are just towards westernization or easternization, looking to them. And Sridip, you are telling that they have included and they are much eager. Why do they not? And for your comment also, one I have said that American sports authority have included this and that. Why do take the references of foreign countries? You just make vigilant of
Sir, American College of Sports Medicine, they develop lot of methods, means and methods in related to exercise. But I am not taking the reference from them. I am particularly talking about the things you are explaining right now. We have to develop our own culture in particularly concentrating on Vyama concept. Because there are many things are already been developed in exercise field, but similar concept is available from more ancient time in our literature, but that has to be exposed to the common people, because many people are not aware of that. That's why they call foreign coach, they introduce foreign exercises into the and they take up the help of all these foreign references. But we have to take the leadership, we have to take the opportunity to introduce our own culture by doing some research work or any other method. That was my version.
Okay, Sridip ji. Here also, one more thing.
Just a sec. I would like to inform Sridip ji that though he is in Telangana, but he is the strict follower of Anand Marg. So Brahma, Anand Marg, he is very religious, spiritual, inspiring speaker. So his arguments are also blessings for us, and he strictly endorsed the Brahma religious Brahma. Jagdishwar ji, please.
हाँ दादाजी, हाँ अभी एक चीज ध्यान दे दीजिए कि अभी कोई एक्सरसाइज के लिए बोलते ही तुरंत अभी यंग जनरेशन जो है ना जिम के लिए दौड़ेंगे, लेकिन एक्सरसाइज घर में क्या किया जाता जानते हैं कि पुराने जमाने से भी दंड और उठ बैठ करना ये तो मामूली है. Everybody knows that Indian culture, but today generation is not going for those दंडा और बैठ, इसके बारे में नहीं जा रहा है. वो जा रहा है पहले जो है ना जिम पे. और दूसरी बात,
for your information, sir, just a minute, for your information, in physical education we actually introduce all these concept of akhada, concept of all these Indian styles of Vyama, we already introduced in the curriculum of physical education from long back. And I just call upon the name of Hanuman Vyam Prasarak Mandal. It is in Amravati. They actually preserve that culture, and they also, this particular institute also get the status of heritage institute from UNESCO to preserve the Indian styles of Vyama. There are institutes throughout India who actually we have to work together, because as we you people working in a area, we are working in an area, we have to share our knowledge, we have to share our work, that we can know each other, and we have to decide the better path through which we have to.
Hello. Hello.
Yes, yes.
Sridip ji, the founder of Ananda Marga is from Bengal. Is from taken birth in Jamalpur, and much is the base in Bengal only. But anywhere much popularity has gone through in Bengal, though there are much followers in Bengal. But at the same time, about the same two references I will give you, that in a daily routine, one should be following 16 points. 16 points. Out of them, if we go to exercises, physical exercises, every Margi, Ananda Margi, has to perform Kaushiki and Tandav for male, not for females. Kaushiki is common to female and male, both. And Kaushiki, just nowadays it is digital presentation, it will be available. Ananda Marga Kaushiki, if you just you will see even the performances, styles, and all those things. Why it is being named by Ananda Murti the Kaushiki? If that dance is performed, and also he mentioned that two things were imparted by Sadashiva, that for male is Tandava, and for female, if it not be exercise, then female through Parvati, it has been given, because all I do not know how many are knowing, whichever been said by Lord Sadashiva is being called as Agama Shastra, and whichever being questioned by Parvati, that is called a Nigama Shastra. With these two combinations only, Agama Nigama, everything is flowing in our culture and performance and pujas and everything. That's why Pandit कहता निगमा आगमा, हाँ उनका मंत्र में यही रहता निगमा आगमा करके, हाँ ये दोनों रहते हैं. तो इसमें जो है ना, जो फीमेल के लिए एक्सरसाइजेज जो दिया गया है आनंद मूर्ति जी, ये कि कॉमन है फॉर मेल एंड फीमेल, दैट इज कौशिकी. Kaushiki means which develops koshas. Rightly, Sridip ji mentioned that much is asanas and yoga is much is psycho-spiritual, and at the same time psycho-physical also, but less in physical and more in spiritual. That will be upliftment. Why it is? Because the higher layers of mind should be perfected first, then only the body will become. And at the same time, how body will be, that means purified and will be systematized. For example, how many people are knowing that a yoga practitioner should consume only sattvic ahara, and the family man to the extent of rajasika ahara, but none are supposed to take tamasika ahara. These also, one sattvic ahara, sentient food, rajasika ahara, mutative food, and the tamasic ahara is called as static food. These three, out of these three, a yoga practitioner is strictly advised, according to Ananda Marga theory, that sattvic ahara is only preferable. This is not been popularized. Why also that? For that also I give
Sir.
Likely. Tamasika ahara
we should wind up by 9, and I would like to invite Rajan Patankar also.
Thank you very much.
But I would like to invite Rajan Patankar ji, senior dignitary from Maharashtra. Welcome Patankar Sahib.
सॉरी, क्योंकि अभी हमारे कॉलेज के इलेक्शंस है, तो इसके लिए जरा ज्वाइन नहीं हो पा रहा हूँ रेगुलरली। तो 17 तारीख को है, तो कॉलेज में बहुत सारे चेंजेस भी लाने हैं। आज का सब्जेक्ट बहुत अच्छा था मेरे ख्याल से। आजकल जो एक्सरसाइज और स्पोर्ट्स, ये दोनों का जो कॉम्बिनेशन जो इम्प्रॉपर हो रहा है, उसके वजह से स्पोर्ट्स मेडिसिन का नीड ये ज्यादा इम्पोर्टेंट हो गया है। पहले जमाने में अपने फिटनेस की तरफ देख करके लोग स्पोर्ट्स के तरफ जाते थे, पर अभी स्पेशली कोई कोई जो चीजें है कि जैसे कि क्रिकेट है जिसमें पैसा बहुत है, तो इसके लिए अपने फिटनेस के तरफ देखे बगैर और प्रॉपर एक्सरसाइज लिए बगैर लोग आजकल वो तरफ जाने लगे हैं। तो मेरे से एक सीनियर थे डॉक्टर केतकर, तो उनका जो ये था, ही वाज अ स्पोर्ट्स मेडिसिन पर्सन एंड ही वाज अटैच्ड टू इंडियन टीम आल्सो। जब भी हमारी टीम 83 में जब वर्ल्ड कप के लिए गई थी तो उनके साथ में वो भी थे। तो बोले कि फिटनेस की तरफ देखते समय वो टाइम में जो योगासन है या जो स्ट्रेचिंग एक्सरसाइजेस है या जो बेसिक, उसके तरफ वो ज्यादा ध्यान देते थे। और बाद में वो अटैच टू बॉम्बे क्रिकेट एसोसिएशन आल्सो, और खो खो और कबड्डी के जो भी इंटरनेशनल नेशनल गेम्स पे भी वो अटैच थे। तो उनका कहना ऐसा था कि आजकल स्पोर्ट्स के तरफ देखने का जो नजरिया है वो पूरा बदल गया है। मतलब फिटनेस से भी उसमें जहाँ पे पैसा ज्यादा है, या हम लोग जहाँ पे प्रोजेक्ट ज्यादा हो सकते हैं, वहीं पे आजकल लोग ज्यादा जाने लगे हैं। तो इसके लिए फिटनेस एक्सरसाइज ये थोड़ा बाजू में रह गया है, और स्पोर्ट्स में जहाँ पे ज्यादा अपने को ये मिलेगा प्रोजेक्शन, वहाँ पे लोग ज्यादा जाने लगे। और व्यायाम के बारे में आयुर्वेद में तो कहा ही है कि अर्धशक्ति करना है। तो आजकल स्पेशली मेरे पास 2-3 बॉडी बिल्डर भी आते हैं, तो उनके जो अलग अलग समस्याएं हैं ज्यादा ये करने के बाद एक्सरसाइज, तो उनके इसमें इनफर्टिलिटी के केसेस भी दिखने लगते हैं। बाद में अलग अलग टाइप के जो भी पेन्स है अलग अलग जगह पे, इरेक्टाइल डिस्फंक्शन, वो भी एक प्रॉब्लम होने लगता है उनको। बाद में हर्निया, जो वेट लिफ्टर वगैरह है, तो इनके तरफ उनको भी ध्यान देना सिखाना। क्योंकि हम लोगों ने, जैसा अभी कहा गया, मेरा लिंक थोड़ा चला गया था कि आखेड़े में उतर करके हम लोगों ने भी कुश्तियां वगैरह खेली है बचपन में, या मलखांब है। तो वो जो फिटनेस था वो अभी भी हमको अच्छा फिटनेस दे रहा है कि जो बचपन में ये किया था। तो उसके तरफ भी कि जो इंडियन सिस्टम है उसके तरफ भी देखना बड़ा जरूरी है। मैं थोड़ा, मेरे ख्याल से जो सब्जेक्ट था उससे थोड़ा हट गया था, पर सॉरी, जो मन में बातें थी वो कहने को मुझे मौका दिया, इसके लिए अभी अग्निहोत्री जी उसके ऊपर टिप्पणी करेंगे। तो पवन जी थैंक यू। विष्णु प्रसाद जी, आज बहुत दिनों के बाद दर्शन हो गए, तो इसके लिए आपको भी देख करके, ऐसे लोगों को देख करके एनर्जी मिलती है कि आपका जो काम है। ओके, थैंक यू।
Thank you, sir. So, to conclude the session with kind regards, I would like to invite Professor V.K. Agnihotri sir for his valedictory remarks.
थैंक यू।
मदन तंगवेलू सर, आप हैं सर, आपके भी कंक्लूडिंग होते। आदरणीय मदन तंगवेलू सर, if you are listening our voice, अग्निहोत्री सर, वेलकम।
थैंक यू डॉक्टर पवन शर्मा जी, नमस्कार। इससे पहले हम कंक्लूडिंग के लिए औरों की बात करें, दो वाक्यों में, अभी वैद्य राजन पटंकर जी ने बात उठाई और डोमा जी ने कही, दो वाक्यों में उनका समूह आ जाएगा। वैद्य जी राजन पटंकर जी अभी कह रहे थे, बड़ी अच्छी बात कही, बिल्कुल प्रैक्टिकल बात कही, कि पहले लोग फिटनेस पर, हेल्थ पे ज्यादा ध्यान देते थे स्पोर्ट्स में जाने के लिए, और कुछ कीर्तिमान बनाते थे, अच्छा करते थे। अभी क्या है, जैसे आपके पास क्रिकेट वगैरह में बहुत ज्यादा पैसा है, तो पहले तो हर कोशिश करके लिंक निकाल के कैसे कैसे एक सामान्य स्वास्थ्य क्रम में पहले टीम में चले जाते हैं, स्पोर्ट्स में चले जाते हैं, फिर टीम में बने रहे और अच्छी परफॉर्मेंस दे, इसके लिए फिर जिम और स्पोर्ट्स को सहारा लेते हैं। क्योंकि अगर परफॉर्मेंस अच्छी नहीं रहेगी तो फिर टीम में नहीं रह पाएंगे। आपके तो ये हुआ। और दूसरी चीज आपने जो कही वो बिल्कुल सत्य है, वो हम भी उठाएंगे कि क्या तो जिम और क्या एरोबिक्स, क्या एनोरोबिक्स, क्या जितनी भी एक्सरसाइज का कॉन्सेप्ट है, अशोक महान के जमाने से और पहले से भी हमारे यहाँ जो अखाड़ा, मलखंब और जितने मल्लयुद्ध की जो व्यवस्थाएं दी गई थी, वो भी शरीर सौष्ठव के विकास के लिए ही थी। और ये केवल एक्सरसाइज बेस ही नहीं थी, इन सब अखाड़ों में भी बजरंगबली जी को पूजा जाता था। उनके जो उपासना विशेष रूप से हनुमान जी रखते ही थे, यानी वो शक्ति, बुद्धि, सामर्थ्य सब कुछ दे और थोड़ा ध्यान भी रहे। तो एक्सक्लूसिवली एक्सरसाइज जो कह रहे थे, डोमा जी कह रहे थे कि एक्सरसाइज जो है वो बॉडीली है, जबकि योगासन है वो मेंटल है। ऐसा नहीं है, बात उन्होंने थोड़ा करेक्ट किया कि एक्सरसाइज 60% तक बॉडीली है, रेस्ट में मेंटल डाल सकते हैं। क्योंकि बिल्कुल सीधी सी बात है, एक 100 मीटर डैश में दौड़ने के लिए लड़का खड़ा है या कोई भी काम करते हैं, तो शरीर तो फिट है, मेंटली भी उसको टारगेटेड करना पड़ता है कि हम वहां पर हमें ये काम करना है, ये जीतना है। तो डोमा जी के मामले में जो भी उन्होंने बात रखी थी कि हमें कोई एक वाक्य में बता दें परिभाषा क्या है इसकी व्यायाम की, इसको हम समझें, तो उसके लिए हमें और ज्यादा दूर जाना पड़ेगा। यजुर्वेद का उपांग है धनुर्वेद, और धनुर्वेद में एक शब्द आया है आयामो विविध अंग्या नाम व्यायाम इति उच्यते। तो एक्सपेंशन ऑफ सो मेनी बॉडी पार्ट्स इज सेड टू बी व्यायाम। क्योंकि आप देखिए कि जब धनुर्विद्या सिखाएंगे तो धनुर्विद्या में कितना बढ़िया, इससे बड़ा कोई कॉन्सेप्ट हो नहीं सकता। बाबा तुलसीदास जी लिखते हैं, खैंच सरासन श्रवण लगी, छाड़े सर 31, रघुनायक सहायक चले मानो काल फनीस। यानी ही पुट द एरो ओवर द बो एंड, जैसे कि वीरासन मुद्रा होती है, हनुमानी मुद्रा होती है, एक पैर बाहर निकाला और धनुष को सेंटर से पकड़ा, पेतंचा को श्रवण लगी, कान तक खींचा। यानी एक हाथ का पूरा एक्सपेंशन है, एक राइट हैंड से होल्ड किया रखा है वो को, उसको एक्सपेंशन है, और दूसरे हाथ को लेफ्ट को जब उन्होंने पूरी पतंचा को कान तक खींचा है, खींच सरासन श्रवण लगी। और ये काम बिल्कुल सावधान मुद्रा में खड़े को नहीं हो सकता है, इसके लिए एक पैर भी आगे निकालना पड़ेगा और दूसरा पैर पीछे करना पड़ेगा, जिससे हम ऐसे शूट करते हैं या धनुष चलाते हैं। तो इसमें इन सबके बीच जो कोऑर्डिनेशन है, और मस्तिष्क कहाँ अप्लाई किया, मनोयोग कहाँ पर हुआ, कि हमें टारगेट देखना है कि नाभि कुंड पीयूष बस आके, रावण के नाभि में पीयूष कुंड है, तो ही वॉज टारगेटेड। तभी ये पूरी तो 31 बाण लगाए, कंसंट्रेशन बनाया, बॉडी पोस्चर बनाया एंड देन मेड ए टारगेट। तो इसलिए धनुर्विद्या सीखने के लिए भी हमें सहारा लेना पड़ता है कि हम किस शब्दों में व्यायाम को चरितार्थ करें, केवल चरण सुश्रुत से बात नहीं बनती। तो उस हिसाब से हम ये नहीं कह सकते कि चाहे वो अपने आयुर्वेदिक व्यायाम की बात हो, एक्सरसाइज की बात हो, वो बिना मेंटल फैकल्टी नहीं, केवल काइनेटिज्म मिलता है, केवल फिजिकल बॉडी में इन्वॉल्व होती है, उसमें गति ऊर्जा मिलती है, ऐसे नहीं है। और रही बात ये कि योग के विषय को अगर छेड़ा जाए तो उसमें संदर्भ और संदर्भ इतने ज्यादा हो जाएंगे, तो वो आज का विषय है नहीं। हमें तो ये देखना है कि हमने स्पोर्ट्स के क्रम में अपनी बॉडी के लिए कैसे कुछ हेल्थ की बात करें। तो हम आते हैं अपने मुख्य कंक्लूडिंग में, 1 मिनट 2 मिनट है। हमारे आज के बहुत ज्यादा सुनाम धन्य और बहुत पूर्व हमारे प्रतिष्ठित विद्वान आज की सभा में जुड़े हमारे वेबिनार में, उसमें प्रोफेसर हमारे विष्णु प्रसाद शर्मा जी।
अग्निहोत्री जी एक शब्द के लिए मुझे मौका दीजिए। अभी पाटंकर जी बोल रहे थे, राजन पाटंकर जी बोल रहे थे, मेरे यहाँ कुछ लोग ऐसे आए बड़े बड़े बॉडी बिल्डर्स, तो जिनको जो है ना ऐसा नपुंसकता का, हाइड्रोसिल का या हर्निया का ये प्रॉब्लम्स आए, एक्चुअली जो है ना इट इज इंस्ट्रक्टेड बाय आनंद मूर्ति जी दैट मेल शुड वेयर लंगोटा, नॉट जांगा, नॉट ड्रॉयर।
लेकिन अब तो स्पोर्ट्स में वो एनाबॉलिक्स पता नहीं क्या क्या लेके आते हैं, फिर पकड़े जाते हैं, फिर उनका डोप टेस्ट होता है, वो सब विषय छोड़ दीजिए। नहीं तो स्पोर्ट्स की हेल्थ और स्पोर्ट्स की हेल्थ की इल हेल्थ के लिए बहुत सारे साधक हैं, जितने भी चीज यूज करती फिर वो अपने लाइफ एक्सपायर कर देते हैं। भाई जो आश्रम उसमें अखाड़े में उतरेगा तो लंगोटा इज द मस्ट, वहां तो कुछ सोचना ही नहीं था, कुछ सोचना ही नहीं था।
इसीलिए हनुमान जी को बोलते थे लंगोटी यार।
आज तो कर्णम मंडलेश्वरी भी होती हैं, दूसरी भी आती हैं, आप कैसे वहां पर रोकेंगे? और उन्होंने भी भारोत्तोलन किया है, उन्होंने भी लंगोटे कुछ अपना एम्ब्लाइकल बांधे है, नहीं तो फिर वो फ्यूमरल हर्निया हो जाएगा, कुछ और हो जाएगा, नसई इंग्वाइनल, बहुत सी चीजें हैं जो उस चीज को समझ सकते हैं। खैर, तो मैं आज
यहाँ पर एक रेफरेंस भी बोले हैं स्ट्रिक्टली, इफ मेल शुड नॉट वेयर लंगरा देयर इज एवरी अपॉर्चुनिटी ऑफ लूजिंग पोटेंसी। Sometimes even he strictly instructed that Margis should pass urine in sitting position only. He strictly said there is every possibility of developing like that.
अब या तो पहलवानी करिए, पहलवान बनिए, या तो पहले 25 वर्ष तक ब्रह्मचारी रहिए और करिए। और यही तो अपना जीवन समर्पित कर दिए कि हम पहलवानी में उसको रहेंगे, जिंदगी में लंगोटा बांधिए, फिर गृहस्थाश्रम मत जाइए। चीजें देखिए बटी हुई है, उसको हम एक दूसरे जोड़ नहीं सकते हैं। फिर वो जब शरीर स्वस्थ रहेगा, वहां हमें वीर का जो है हमें संरक्षण भी करना होगा, और हमें बल पौरुष बढ़ाना होगा, कंसंट्रेशन बढ़ाना होगा। हनुमान जी के उपासक बनेंगे तो ब्रह्मचारी तो वैसे ही बनना पड़ेगा।
हाँ ना, यहाँ पर ना
हमारे गांव विश्व विजयी गामा हुए हैं, कल्लू रहमान हुए हैं जी।
अग्निहोत्री जी, यहाँ तुरंत फिर ब्रह्मचर्य के बारे में मत कीजिए। ब्रह्मचारी बोले तो ये मतलब
आज नहीं
ब्रह्मे विचरणम विचरणम इति ब्रह्मचर्यम।
आज मुझे अभी दुर्गा सप्तशी पाठ करना है, 2-2.5 घंटे लगेंगे, आज हम निकल रहे हैं।
तो सेलिबेसी के बारे में ब्रह्मचर्य नहीं होता है। ब्रह्मचर्य का मतलब होता है
एब्स्टिनेंस एंड सेलिबेसी बोथ। ब्रह्मे आचरति चर्यम इति ब्रह्मचर्यम। ब्रह्मचारिणी दोनों के लिए आया है, ब्रह्मचारी और ब्रह्मचारिणी दोनों के लिए आया है।
हाँ,
वो अलग ब्रह्म के बारे में ज्ञान की प्राप्ति करना।
वहां पर सेक्स का कोई ऐसा नहीं होता है। और एक्चुअली जो है ना, आज तक जो है ना, ब्रह्मचारी बोले तो जो अविवाहित है उसी को भी ब्रह्मचारी बोला जाता है।
ना इसमें भी हम फिर तो मैं अटल बिहारी वाजपेयी को रिफर करना पड़ेगा। उन्होंने बहुत स्पष्ट शब्दों में कह दिया था।
पता नहीं, मैं तो नहीं जानता उनका क्या है।
आप जानिएगा, बहुत बढ़िया बात कही थी। ये सब लाइव और रिकॉर्डेड है, मैं नहीं कह रहा, लेकिन बहुत स्पष्ट क्या बड़ा बहुत ही स्पष्ट शब्द है, जो लोग जानते हैं वो समझ रहे हैं।
वहां पर तो
मुझे अपनी जिम्मेदारी निभाने दीजिए, मेरा समय कम हो रहा है। तो आज के हमारे रेस्पेक्टेड गेस्ट लोग हैं, उनको अपना रिवॉर्ड्स देते हैं। प्रोफेसर विष्णु प्रसाद शर्मा जी गुवाहाटी असम से, और डॉक्टर जगदीश्वर डोमा जी, डॉक्टर पवन कुमार शर्मा जी हमारे, वैद्य जयेश ठक्कर जी, वैद्य निशांत त्रिपाठी जी, उनका हम एक भी वाक्य नहीं ले पाए, प्रोफेसर बंदन सर जी, और वैद्याजन पटंकर जी, हमारे शिवस सर जी, सभी लोग रहे। और साथ में हमें जहाँ एक तरफ इनॉग्रेल सेशन में वचन मिले, आशीर्वचन मिले हमारे वीपी शर्मा साहब के, वही अदर हैंड हमारे श्रीदीप जी ने भी, चटर्जी जी ने आज के सेशन की जो शुरुआत करी अपने ब्लेसिंग्स देके, अपने गाइडलाइंस देके, उस सब के ऊपर जब तक कि हमारे लोगों के गेस्ट लेक्चर्स तैयार हो रहे थे, प्रोफेसर मदन जी आगे बीच में, उन्होंने बात तक की और बड़ी महत्वपूर्ण बात तक की कि ऑस्ट्रेलिया में 7,700 स्कूल्स पर एक सर्वे हो रहा है, जहाँ पे देखा जा रहा है कि 38% बच्चे जो स्कूल में आ रहे हैं वे ओवरयूज हैं और ओवरवेट हैं। तो उसके लिए उनमें कहाँ पे कैसे प्रयास किया जाए, कहाँ कितना डाइट पर रिस्ट्रिक्शंस लगाया जाए, कितनी एक्सरसाइज करने के लिए उनको मोटिवेट किया जाए, इसके लिए कॉलेज मैनेजमेंट, टीचर्स और स्टूडेंट तीनों को ही रेस्पॉन्सिबल मान के उन्होंने एक प्रोजेक्ट करी है। तो बड़ी अच्छी बात है। भारत में भी हम लोग इंडिफरेंटली खाते हैं कहीं, बल्कि इस बात के लिए क्रेजी रहते हैं कि दूसरे कंट्री का इटालियन है, मंचूरियन है तो ज्यादा ही खुश होते हैं, ज्यादा पैसा देके खाने में विश्वास रखते हैं। सत्तू का समय है, सत्तू कोई नहीं खाता है, तो खरबूजा तरबूज का समय वो नहीं खाता है। ये सब चीजें हमारे लिए लाइफ के लिए है, और स्पोर्ट्स के इवेंट के लिए भी है, हेल्थ के लिए भी है। खैर, उन्होंने अपने एक थॉट रखा था, तो जो बात रखी कि एक्सरसाइज इज ए पॉपुलेशन मेडिसिन फॉर मेंटल हेल्थ, ये बात से शुरुआत हुई थी। आज हमारे पहले जो मधुसूदन हजारा जी थे, उन्होंने अपनी बात रखी और वो इतना डिटेल से डिस्क्रिप्शन दिया, अब हम समझ नहीं लेंगे, कि लास्ट में आके उन्होंने मॉडर्न मेडिसिन के ट्रीटमेंट भी बता दिए। एंटी डिप्रेसेंट क्या है, एंटी एंग्जाइटी क्या है, मैं तो धड़ाधड़ लिखता चला गया कि प्रोसेस लिखा उन्होंने, जेलेंक्स लिखा, जेफ्सन लिया, पूरा ट्रीटमेंट दिया। ड्रग्स को हमारे बताने मतलब ही नहीं था, हम तो वैसे आयुर्वेद परख है और दूसरे औषधियां तो अवॉइड करें, बट उन्होंने एक अपने प्रेजेंटेशन को कंप्लीट करने के एंगल से साइकोलॉजिकल बेनिफिट्स बतलाए, उन्होंने सोमेटिक बेनिफिट्स बताए, मेंटल हेल्थ के बारे में काफी चर्चा की। तो ये उनकी प्रेजेंटेशन रहा जिसमें उन्होंने मोस्ट ऑफ द एरिया कवर किया। उसके साथ ही साथ हमारे दूसरे साहब जो थे वो अपरूप कोनार जी थे, तो उन्होंने इसी कंटिन्यूएशन में भी अपनी बात रखी कि हम क्यों ना इन सबको ऑब्जर्व करते करते साथ में थोड़ा योगिक प्रैक्टिसेस को, जिसमें कि केवल आसन ही नहीं, आसन जब करेंगे तो हम यम नियम से बिना बात बनेगी तो अधूरा कहलाएगा, और बिना ध्यान लगाए हम कहते हैं भाई मन से पढ़ो, तो क्या मन से माने मनोयोग से पढ़ो, तो हम पढ़ने में भी जो केवल सिटिंग पोस्चर बैठे तभी लगाना पड़ता है। अरे भाई ये काम मन लगा के कर लो, चाहे दाल चावल बीनना भी है तभी कहते हैं भाई मन से लगाना, नहीं तो 2-4 कंकड़ ले जाएंगे। तो योग की तो इतना कॉन्सेप्ट है, मैं तो इतना शुरुआत पढ़ाता था, जैसे एक पेन है, तो अगर पेन के कैप का इसके बॉडी से टच हो गया तो ये योग हो गया। ये इन विट्रो इन विवो होता है, इसमें माइंड की जरूरत नहीं है। अगर नहीं होगा, ये खुला पड़ा रहेगा तो इसका ड्राई हो जाएगी, रिफिल बेकार हो जाएगी, फिर दोबारा चलेगी नहीं। तो हमें चीजों को इंटेक्ट रखने के लिए योग से, मनोयोग से काम करना चाहिए। लंबी बहस में अगर हम पढ़ेंगे तो आई डे 21 जून शुरू होकर अगले 21 जून तक चलते ही रहेगा। इतने रही बात लॉर्ड शिवा के लिए, तो कुछ सोचना हमारी हैसियत ही क्या है जो कहें, वो तो सदाशिव हुए ही हैं, इसमें कोई शक नहीं। फिर हमारे योगेश्वर कृष्ण जी का नाम आता है, ये बिल्कुल सही है। मर्यादा पुरुषोत्तम रामचंद्र जी ने अपनी लाइफ अपने तरीके से जी है, लेकिन आज के युग में जब महर्षि पतंजलि का या अपने दूसरे आगे अरविंदो साहब हो गए, रमन जी हो गए, विवेकानंद जी हो गए, रामकृष्ण परमहंस जी हो गए, वर्तमान में कलयुग में जो लोग मौजूद है, हमें उन्हीं को आदर्श मान के उनसे ही भी कुछ मिल जाएगा, तभी हम लोगों का जीवन और स्वास्थ्य सुधरा रहेगा। तो ये हमारे दूसरे कोनार साहब की बात हुई। फिर हमारे जो पलाश जी ने था, उन्होंने इस चीज को भी पुनः स्थापित किया कि उन्होंने पंच में वो पंचकोश की थ्योरी रखी, और ये माना कि हमने पहले भी कहा था कि पंचकोश में जो अन्नमय कोश है, जो ग्रॉस बॉडी को रिप्रेजेंट करता है, और वो अन्नमय कोश हमारा बनता है भोजन के द्वारा। अब भोजन कैसे बनता है? पृथ्वी से हर्ब्स बनती है, हर्ब्स से फूड बनता है, फूड से फिर बॉडी बनती है, बॉडी के अंदर ही माइंड होता है। तो ये एक्सरसाइज का जो कॉन्सेप्ट ने शुरू में भी कहा था, ये तो इंट्रा यूट्राइन लाइफ से शुरू हो जाता है। इन विवो जो हम कहेंगे, तो इन विवो नहीं, इन यूट्रस, इन ऊम्ब में ही जब बच्चा पैर चलाता है, इसलिए कि पूरे शरीर में सर्कुलेशन मिले। डाइट तो उसकी थ्रू प्लेसेंटा ब्लड से मिलती है। जब कंक्रीन करता है, जबकि एड़ियां गड़ती हैं, तो और ये हुआ दूसरा एक और वो काम करता है, वो इम्यूनिटी फ्लूइड में फ्लोट करता है, दैट इज ए गुड एक्सरसाइज। तो जन्म लेने से पहले से ही जो हमारा पंचभूतात्मक शरीर है, वो एक्सरसाइज से जुड़ा होता है। ये तो ही फिजिकल और मेंटल का जो कॉन्सेप्ट ने शुरुआत में भी कहा था, उसके लिए अभिमन्यु से बढ़ के तो कोई उदाहरण ही नहीं है कि उन्होंने मेंटल पावर उनकी कितनी हाई फाई और कितना मनोयोग रहा होगा कि अर्जुन जी के सुनाने पर द्रौपदी जी को उनको चक्रव्यूह भेदन का जो स्टार्टिंग कॉन्सेप्ट, जैसा कि हम लोग परंपरा पर सुनते चले आ रहे हैं, इसमें कोई डाटाबेस है, इसमें एविडेंस बेस नहीं है, कोई किसी के पास कलयुग में रहते हो किसी के पास प्रूफ नहीं है, लेकिन हम लोग इस चीज को डिनाई भी नहीं कर सकते हैं, क्योंकि हमारे पास डिनाई करने का भी कोई आधार नहीं है। तो मेंटल एंड फिजिकल सपोर्ट के लिए, हेल्थ सपोर्ट के लिए एक्सरसाइज इज ए पार्ट ऑफ लाइफ, और उसके एक्सरसाइज के लिए द फूड इज ए पार्ट ऑफ लाइफ, एंड देन yoga is also a part of life. So with these words, we would like to conclude and congratulate all the great speakers who poured their all knowledge to our today's webinar, and I extend my all the respect to all the revered and regardful persons, and all credit goes to our Dr. Pawan Sharma sir, who is entirely doing scoring betting at 350 score today, and not letting her body and mind allowing to take rest. I don't know which type of exercise in the reference of today's exercise, which type of physical and mental exercise he is performing hidingly, just to give such type of output out of his AYUSH SAMRIDDHI this webinar. Thank you so much.
अग्निहोत्री जी, अभिमन्यु का इम्बाइब करने का साइंटिफिकली बता सकते हैं, if they are much consultant with Anandamurti theory, because he explained.
अब देखिए, आप आनंद मूर्ति जी को मानने वाले, सुनिए, आप आनंद मूर्ति जी को मानने वाले हैं, लेकिन मान लीजिए कोई चाइना में नहीं मानता है तब, तो इसलिए हम अभी भारत में तो हमारे लिए इतने लिबरल हैं, हर मत
I am not telling about China.
बात कर रहे ना, पंच महाभूतात्मक साइंस को ही स्टैब्लिश करने में कितने युग निकल गए। अभी हम जितने हैं उतने पे हैं भाई। आप आनंद
नहीं, अभी जो है ना,
बाबा कहेंगे, कोई कृष्ण मूर्ति को कहेंगे, गुरु नानक देव जी को कहेंगे, तो वो तो फिर सबकी अपनी मान्यता है, सबके भक्त हैं, सबके अनुयायी हैं, सभी अच्छे हैं।
अग्निहोत्री जी, थियरी इज टू रेफर फॉर ऑल,
राइट,
थियरी इज रेफर टू फॉर ऑल, not I am telling that you accept Anandamurti ji.
Right.
I am accepting that scientifically you go for analysis how Anandamurti ji has explained in the scientific way.
Right.
The materialist should also go down in front of the Ananda Marga theory.
Good.
None can challenge these I do not say that religious side.
No.
I say that
it's not about a challenge. Even the theory of Sir Albert Einstein was challenged. It took 30-40 years just to re-establish E is equal to mc square. Let it be challenged, but the truth should come out. It's not a matter of challenge and taking otherwise. it's a science. If it is science, it will be true and it will be established. So either person one should not take in either personal matter. It's a challenge. It's a science open for everybody. Let others think according to their own wisdom.
Perfectly.
Right, sir. Right, sir. Thank you. Over to Pawan Sharma ji. Sharma ji. Hello. Sir.
जी
Hello.
सर, प्रणाम प्रणाम सर, बहुत अच्छा लगा। आज का तो बिल्कुल इंटरेक्टिव वेबिनार हुआ। बहुत बहुत धन्यवाद सभी महानुभावों को, बहुत बहुत
विदिन टाइम
धन्यवाद।
भी है आज, विदिन टाइम है, थोड़ा रिलैक्स है जी।
हाँ जी, आज विदिन टाइम भी है। Thanks and salute to all for cooperation by which we have been able to achieve 350th webinar today. ये हरि अनंत हरि कथा अनंता की तरह हम लोग रहे कि न रहे, ये वेबिनार सीरीज चलती रहे और नई जनरेशन चलाती रहे, ऐसी शुभकामनाओं के साथ फिर आपसे आग्रह करता हूं कल जुड़ने का। वर्ल्ड हेल्थ डे है कल। परसों शनिवार को बड़ा यूनिक प्रोग्राम रखा है, एस्ट्रोलॉजी फॉर हेल्थ। इसमें 5 बंगाल के एस्ट्रोलॉजर बोलेंगे। उसके बाद संडे को वर्ल्ड होम्योपैथी डे है, उसमें 8 एक्सपर्ट होम्योपैथी के बोलेंगे। 11 तारीख को सोमवार को नेशनल वुमेनहुड डे, मदरहुड डे है, सेफ मदरहुड डे। उस दिन हम लोगों ने सूतिका परिचर्या पे वेबिनार रखी है। उसमें 8 अपने आयुर्वेद की गायनेकोलॉजिस्ट अपने को गाइड करेंगी सूतिका परिचर्या के लिए। स्वागतम स्वागतम। दिस प्लेटफॉर्म इज योर्स सर, प्लीज ब्लेस अस।
थैंक यू। शिवरात्रि।
थैंक यू।
अभी ठीक है ना अग्निहोत्री जी? अभी ओके ना इधर?
बेटा थोड़ा बस गले में थोड़ा ठीक है अब।
अच्छा, ओके। टेक केयर।